Hey guys, this is Deep Dive Gaming, and today we're doing the 5th episode of Diving In, and we have a super special guest today. This is Minas, I think former heart surgeon, and yeah, just tell us a bit about yourself.
Hi, thank you for the invite, first of all. I'm Minas. I'm in the General Hospital of Larnaca. I'm heart surgeon, specialist, whatever you want to call it. That's it, pretty much. Out of that, I just like gaming, and yeah,
Wow.
that's it. It's pretty boring.
I didn't know doctors had lives, but okay. Didn't know they had time to game. But also, I wanted to say for this special episode, we're doing this thing where every 5th episode of the podcast, we're doing a no gaming edition. So maybe like something gaming related comes up here and there, but it's not our focus at all. So we've got a bunch of stuff lined up to talk about. One thing, but like we want to talk about very much so is fucking medicine and heart surgery. Like, so what I want to know first is like, why did you want to become a heart surgeon, and how did that line up with your expectations when you actually became one and started doing surgery and everything?
Yeah, in retrospect, everything like what is it? Foresight is 2020. Yeah,
Hindsight.
it's hindsight. Yeah, foresight, hindsight. Thank
Same
you
shit.
already for it's already derailing.
Look, it's not a doctor in English, okay?
I don't know. I'm not that much a patient of a person in general. I like going in there and fixing something as fast as I can when it's possible. And surgery in general gives you that ability to just go in there, fix something. Doesn't have to be. It can be anything, any type of surgery. And I was always interested with the heart because in my mind it's the most important organ in the body. Technically not true.
I mean, the brain, right?
Yeah, like you. Yeah, again, it's a yes and no answer. Like heart has a way to beat. It's give a rhythm to itself. So it's kind of we don't need the brain, But again, you do need the brain. It's the obviously most important organ.
I have a quick off-topic question. Sorry to cut you off.
Yeah.
Do people going through heartbreak actually have something wrong with their heart, or is that not true? I know it's probably not true, but like I swear sometimes you feel it.
There is like funny you would say that there is a specific syndrome. It's called the broken heart syndrome, which is actually
I've heard of that.
the strings attached to the valves of the heart that go to the papillary muscles between break. It has a very scientific name that kind of eludes me right now because usually you don't catch it very fast. But it's called like you can if you say like broken heart syndrome, is what you're actually talking about. It's a weird Japanese name, I believe.
That's really cool.
Yeah, but no, most of the people are just like it's just hurt.
Yeah, fair enough.
Yeah, up here mostly.
Yeah, that's true. So, what's it like actually giving heart surgery? Like, and like, how about your first time as well? Was that nerve-wracking or?
It's the first time you just the first time you were looking at a chest cavity, you're not touching the heart, right? You just, if you're lucky, you're holding clamps open, just holding clamps, and if you're not lucky, you're just up looking down to the people who are in the operation in the theater. So first it's they slow you in the whole process. You don't start immediately, just Grey's Anatomy style, put your finger in the aorta and just stop the bleeding. It's a bit more relaxed.
Okay, so it's not like here's an 80-year-old man. He's not going to make it anyway. Oh, Pink's having some technical issues. But yes, so it's not just like, oh, here's an 80-year-old man. If you don't make it, fuck it. He had 5 years. They like really ease you into it.
Yeah, no. It's a really tedious process, and you have to convince your attending the boss that to let you scrub in. Like some of what you might see in some shows, like Grey's Anatomy, might have a smidgen of truth of like how hard it is to get into an operation.
Okay, Pink, your webcam froze, by the way.
Is it still frozen?
Yeah, it's frozen.
Yeah.
Oh, god damn it!
In a very in a very like Napoleon.
Yeah, true. Just looking off into the distance.
Fuck you, camera. Sorry.
There you go.
All right, first, so what was it like the first time you were properly doing the heart surgery? Like, how long did it take? And were you nervous, or had you seen it been done so many times and practiced so much that it felt second nature?
Yeah, I think I would be the latter one because you see it so many times. You view videos of it. You see techniques of it. Like you talk with the people. Your boss is like coercing you to watching the replays of the footage of what went wrong, what went right, like previous. And at the end, it's like, okay, there's a bit of a stress, like, oh, am I be moving too fast, or am I just, did I connect this in the way I should be, or should I put another suture here or there just to make sure everything's more or less airtight or blood type tight. At the end, these are the worries, and you don't focus on, I'm actually putting my hands in someone's chest, like literally in the chest cavity. You don't think of it too much.
Okay. So is it the case if you make like one mistake, like, oops, I snipped a bit too hard with the scissors, do they just die, or how does that work? What's your room for error when you're giving heart surgery?
Depends on where. It depends on the operation as well, right? It's not all the operations are the same risk. Depends how the vessels are. Like if you have calcifications or an 85-year-old man, a slight mistake might like just make the whole aorta, force it to crumble, like legit, like dry sand. Just crumbles. There are things like that which are like extremely scary. Happened before. You just lose a patient at that point. But anyway,
is it normally with older patients, or are there some like rare conditions and scenarios where there's younger people and you have to? Because I wanted to ask anyway, like, what's the most common kind of reason people need heart surgery, and like, what are the really dangerous ones that are scary to give?
Okay, well, the most scary one to give is the standstill surgery, which is, again, it's a term that we give then when you try and cool off a body, kind of induce death in a way, stop the heart. Now we stopping the heart. We try to work while the heart is beating, which is kind of more complicated.
Oh wow!
But the standstill surgery is like you stop the heart, and you do what you have to do. You have about like 30 minutes to do so, and then you restart and you reheat the body, and you hope there is no, like, to reduce neurological damage and reperfusion injury down the line. And so you reduce the metabolism. You put them in the freezer so it doesn't spoil that fast.
Right.
Does that make sense?
So what you do is, and I just want to make sure I've got this right. So like in some serious cases, you have to like freeze the person down, pretty much, get them really cold, stop the heart, and then you try and fix them, and then you heat them back up again.
Yeah, like when we say freeze, obviously we're just talking about
31,
like a maximum. Like it's like if when you go 29, it's already getting really effy. You just put cold fluids and you just hope.
And what's the kind of success rate of a surgery like that?
It's not done very often, right? It's something like really niche, and because of that, there's no like. It's not okay. Let's say the surgery most of the time, because like not because I'm doing it. I've done it only once as a first, right? But in general, it goes well. Like in general, people do get it right.
Okay.
The problem is patients might die because of complications, so that tallies up negatively for that operation.
Right, so like even if you do the operation correctly, they might not survive.
Yeah, so the operation was a success, the patient died. So what is the verdict? It's an effie. It's an unfair question.
That's unlucky. So I wanted to ask, what kind of scenario or what kind of conditions kind of are the most difficult to deal with? Or like in the case we were just talking about with freezing down a body and heating it up and having that 30-minute window, what condition is that? Do you know, or does it really just depend?
It depends on what. Like there are doctors who are really comfortable in doing that nowadays, as I said, because like if you stop the flow from a calcified vessel, like that has deposits of calcium on it, and then you start again the heart, the rise of pressure might rupture it, right? So nowadays we try to avoid stopping the heart in this way. Like that's what the guidelines say. No one does that anyway that much, but that's the tendency to just stopping the heart, try to work while it's beating, so you don't have great changes in
that must be more difficult though, no? To work with it while it's beating.
Yeah, that's why that's why like the cardiosurgeons and neurosurgeons have one of the longest training. Like for the cardiologist, it's 6 years, 4 years cardiology, 2 years pathology. For a cardiosurgeon, it's 5 years, just cardiosurgery, and 2 years just surgery. So we have extra things on top of everything. And if you want to specialize in these really niche type of surgeries, then it's 2 years on top of that, and it can get very convoluted very fast in terms of operations and how much you have been trained.
Yeah.
Mostly just like it's cabbage, and it's like you take the vein from the leg and you connect two blocked arteries, the bypass, right? It's bypass surgery that you hear all the time. But even that nowadays, because thank God cardiology and with the stents and the catheterization procedures has taken a lot of these weight away from cardiosurgery. We don't have to do this operation that much anymore. You don't hear that much of an open heart surgery anymore because thank God cardiology is advancing so fast. I'm kind of jealous I'm not in that ship. It kind of feels like cardiosurgery is slowly like putting to the side.
Can I ask as well, though, if you're operating on a beating heart and then you have to suture it, like, first of all, doesn't blood while you're operating essentially, for the lack of a better word, leak? So that there's and do you put that back into circulation, and then how do you actually suture, like, without going into the technical details so people don't try that shit, but how do you actually like do a suture that doesn't leak?
There's no way for me to explain that. There are a billion ways to try and suture a vessel in terms of like how you will suture it, right? There is the reverse 8. There is many techniques that you can implement to say, okay, the vessel is like airtight or blood tight. Okay, so the problem with the moving, that's an issue. But usually you try to suture on an area that's not that much affected from movement, right? There are areas in the heart that are kind of more like structurally stiff, so you can work around those areas a bit better. Obviously, you're not going to try and go to the apex of the heart, the point of the heart, and then just try and suture it there because it moves 1 to 2 centimeters down. So there is no way you can suture that. But a bit higher up or a bit after the curvature, there are areas that you can use. It involves around suturing and glue sometimes.
I have a question.
Or just stopping the heart.
Can you use good duct tape? No, seriously. Is it possible? Like, theoretically?
Well,
sure, I understand it's unethical.
Yeah.
But is it possible?
What, to use duct tape to stop a leak?
Yeah.
I can answer that. No.
I mean, it depends on your setting. Like, if you're in a war zone, right? And if your body got shot and you don't have anything, you just have tape. Sure, put your shirt on that bleed and just tape it down like a motherfucker. It's gonna work anyway. It's gonna work. It's gonna do a well enough job.
True. In the culinary side, we use glue a lot, right? So if I cut myself on the finger while I'm in the kitchen, the first thing we do is put super glue in and close the wound.
Wait. Super glue, like
cyanacrylate, yeah.
That's weird. You super gluing yourself?
It's not permanent and it stings like a bitch, but it works.
Why don't you just put alcohol on it and just kiss it?
Because the super glue stops it from bleeding, and you don't have a plaster that can fall into the food.
Oh, I see.
Because you need to keep
cooking.
Working.
Yep.
Okay, that's kind of brutal.
You big cut. You're like, oh shit! You hold it underwater, wash it out, hold it closed, super glue, done.
Okay, so
that's what you do in the kitchen.
What if, say, you're doing like that surgery, the very rare one where you need to like make them cold, and then you only have 30 minutes, right? What if you're there, you're 20 minutes in, you're like, okay, let's finish the suture, pass, and the other person's like, fuck, we forgot it, we only have duct tape. Go.
Okay, so the hospital having the ability to do a standstill surgery and then running out of...
No, they forget the duct tape. They forget the suture, but they only have duct tape. They're like, fuck, here's some duct tape. What do you do?
I probably wouldn't close it. I probably would just bring him back and...
Sorry, man, you're dead.
Well,
sorry, dude.
I would kiss my license goodbye at that point. That's what would happen. It's like, yeah.
Would you really get your license taken away if like, are you the one that's required to bring all the tools and stuff? Because normally there's a team around it, right?
No, but like when you get to be the first, anything that goes tits up, it's your fault.
Okay. Shit.
From, I don't know, even ceiling falling, that's like, even just small pieces of drywall falling, that's your fault. And everything is your fault.
That's
like
harsh.
military thought It's like everything happens, it's your fault. Yeah, okay.
Damn.
Yeah, it's kind of retarded.
Yeah, I've heard that the field of medicine is very stringent, to say the least. Like, I mean, and obviously you see it represented in some movies, but I'm not sure how accurate it is. Like, I don't know if you've seen Doctor Strange, but obviously is this really really famous doctor. I think he does heart surgery as well, but I could be mistaken.
Doctor Strange or good? What? Wait,
It's a superhero movie by Marvel.
wait,
I think.
are we talking about Cucumber Batch?
Yes.
Yeah,
okay.
Cucumber Batch. Yeah, we're talking
Oh,
about Benedict
yeah, because
Cumberbatch.
he was a
Yeah, right.
neurosurgeon, right?
Oh,
So,
he's a
okay,
neurosurgeon. That was it, right? But
I was thinking, what doctor? He's a magician. Am I
not a
missing?
magician.
Like, that's
He's got
what I.
the
Yeah,
cape.
but yeah, you're right.
Yeah, yeah.
He
He was a
loses
surgeon,
his-
and then he like people, his assistant, whatever, would be like, "Do you want to do this?" And he's like, "No, it's this condition too tough. Someone else." Because there's this conception among medicine and especially with doctors that sometimes the best of the best try to take only cases where they know they can successfully operate,
Oh,
and
yeah.
they don't want to take
Oh, yeah.
risks. How true is that in your actual field?
Okay. Because what we are okay in cyber. All right. In general, it's super true. Okay. In general, it's super true. In Cyprus, particularly, because we don't have that type of infrastructure yet, where you can review the doctor and say, oh, how good it is, what's his ratio and stuff. Kill to death ratio. It's literally what you could name it. We
Well,
don't
it's
have that.
2.5 in Call of Duty.
Yeah, okay, pretty much. But we don't have that as much. People tend to be a bit more relaxed when they take up patients, but it's something that you will think. Because, for example, if you have an 85-year-old man who had diabetes, who had hypertension, who has 4 closed arteries, and then on top of that has athermatic plaques on the aorta, and you just have to do a replacement surgery for the aorta, and you're like, yeah, he's probably not gonna make it, right? It's gonna be a surprise if he makes it. So at that point, you say, I don't want the patient, and you try to explain for this and these medical reasons, but many of them still go and say, I don't want the patient. They say it's because of medical reasons, but instead the reasons are clearly he's gonna die, and I don't want to have a negative ratio or whatever.
Yeah.
A bad.
Is it also the case where it's like this person's gonna die and like that's the most likely scenario, and like if I don't think I can like save him, or if I don't think anyone can, then what's the point?
Yeah.
Like you're better off giving him the fucking knife. I don't know.
The truth is like
Seppuku.
seppuku. Yeah, if the patient has cancer, for example, right, and terminal cancer is about like 6 to 7 months, and let's say he has an aortic aneurysm, which is like a bulge in the aorta, which is the major vessel that comes out of the heart. Okay, you can operate on that, but what you're gonna give to the patient? Are you gonna give 6 months?
Oh, okay.
It's a weird
So
ethical
it's more extending
dilemma.
their life than saving it.
Yeah, it's like I rather not put you through the pain of the knife because you can die anyway. You don't say it like this, but that's basically what it is in the end.
So have you been in that scenario before where you've like maybe extended someone's life by doing a surgery and then you have to tell them like, the kind of circumstances, or no?
If I saved someone's life,
Oh no!
What do you mean?
Yeah, have you been in a circumstance where say you like perform on the aorta with like a cancer, right, a tumor, and then, but it doesn't like but it just extends their life. Have you like done that, and you have to say to the patient like, look, you only have 6 months to live or something.
Thank God I didn't go into oncology. It was something I would never be able to do. I don't have the mental capacity for this. Like 100% not.
Yeah, that'll be hard.
So if they're paying, right, and at that point they're the ones that decide, and I sit down with them and tell them, listen, if I do this, it's not gonna help things out. It's not gonna improve your way of life. It's just gonna put you some more pain until you die, because you're gonna die. If you want to do the operation, I'm happy to do it. Mainly because I wanted to get a lot of experience on this at that point, so I wouldn't say no to operations just because I was just want to learn. But like when I try to give them my opinion of why I wouldn't do it, I wouldn't put my dad if it was in the same case through that operation. That's like I try to, and it's not a good thing to do, but I try to say what I would do in their place. But that's just their decision again. And there's doctors that are going to tell you shouldn't say that. It's preferential.
Fair enough.
What
So,
you do
with that specific example, say like it's a case where okay, they die anyway, but if you do the operation, they have another 6 months to live. Do like in that time, like will they have complications from the heart surgery, which actually makes life like unbearable, very difficult, or is it they're just living for another 6 months?
if we're talking about like cancer patients,
Yeah.
depending on the cancer, pain from the operation is nothing to them. Think about bone cancer, pancreatic cancer.
Bone
These
cancer seems
things,
horrible.
like they don't give a shit if you just cut them open. Like some of them just like, oh, you know what? The pain from the operation kind of removes my mind away from the other type of pain.
Right.
So for them, it could even be a very like perverse relief on what they're going through.
Okay.
Yo, that's kind of fucked up though.
It's I hate this type of operation. It's something that makes me, because in the end you come home and you're like, okay, what did I did today? And you're thinking it's like, I gave a cancer patient more pain, possibly prolonged his miserable life for about 6 months or so, if he's lucky, and if I haven't fucked up, and if everything holds, and if the cancer doesn't metastasize in between the sutures and push it apart. There's
God.
and you're thinking like, did I help? Actually, or just cause more pain in the end. But it's their choice.
Oh, man.
Like,
That
it's
is like
100%, their agency to choose.
sure, but
so
it's
I think
horrible
it's
for them, and
as
it's
well.
horrible for you as well, right? Mentally.
Yeah.
well,
of
no,
course.
I don't put myself too much in the equation. Doesn't make sense. I choose to do that. I'm either I live with the consequences or just quit, right? But they didn't choose to have cancer, even if they were smokers. I don't subscribe to the idea, oh, you have lung cancer because you're a smoker, then you had it coming. Fuck you.
Yeah,
No,
no,
you
I
don't know
agree.
what
Of course. No, that
no.
would be stupid.
Yeah, but like they didn't choose, although they could have chosen better, but they didn't really choose, oh, I want to get cancer. So
That's like saying
it's not their
like,
fault.
oh, you drank alcohol once and now you're an alcoholic. You had it coming. It's like, what?
Yeah,
The logic
Yeah,
really doesn't
makes
add
sense.
up.
Like,
Yeah, so it's not like, yeah, the things that I really enjoy like in operations is like emergency gunshot wounds, stab wounds. These are interesting stuff when they are in the chest area. There are things that you can do to help always, almost, if you
So,
have enough time.
Why are those operations like? What makes them more interesting from your typical? I eat
They're
bacon
kind of
every morning.
unique. They're kind of unique. Like, okay, there's a billion places you can plunge a knife. I sound like a psychopath, I swear to God,
No,
but it's
all
it's a
right.
billion places.
You're a doctor.
right?
Everyone on YouTube knows you're a psychopath. It's all right.
damn, Minas, holy shit. Actually, in terms of knife plunging, question. There's this kind of common knowledge which I question, that bayonets and triangular-sided knives were banned because of how inhumane they were to treat. How would you feel about, like, how could you think, like, would suturing a triangular cut be, obviously it's going to be a bit more difficult, right? But would it actually be impossible? Like, would people have a much higher tendency to die of these larger triangular cuts, or what exactly is the reason, do you think?
As with any cut, right? I could get this, and I could cut in a place that I could kill you, right? Like anything that could happen. So it's not exactly the knife; it's the area as well.
Okay.
But especially with triangular knives, the problem is, if you're gonna use it appropriately, is push it in and twist, right?
Right.
Twist. So in this way, you introduce air inside anything else, right? So at that point, there are a couple of things that could go, especially from depending on what side you are. If you're receiving this stab wound or giving the stab wound, can go well or bad. For example, introducing air, you can have a bubble go to the brain and just have a stroke.
It poisons the
Same
blood,
thing.
right?
Hmm?
If you expose air to
Embolus.
it poisons the blood, right?
Yeah,
Essentially.
I mean, poisons or just lodges. It's used as a thrombus. It goes and lodges itself somewhere, either
Okay.
the lungs, heart. If you're
Brain,
lucky,
yeah.
just a limb. That would be very lucky. Brain, and then you die from that. Or twist, turn, you cut vessels, you shred areas, and they bleed more, and they die from bleeding faster. So there's like a lot of ways that you can. Like there was a knife I was reading that it would inject air into the wound when you did that.
What?
That's
So
horrible.
yes. So that's truly horrible. But you can suture a wound. Like I've done it on legs. It's kind of a pain in the ass because it's kind of deep.
I think it's a
because they
pain
are
in the
not-
leg.
Yeah. It's a pain. Yeah, it's a pain in the ass to deal, but it's not like, oh my god, I cannot even deal with it.
Okay.
If they were banned, I don't know. They seem pretty unreasonable as a way to save it. I would think that would make more sense why they got banned.
That is a horribly genius thing. A knife or something that injects air into you.
That's fucking horrible.
That's just a
But,
fucking
you know,
killing machine.
about air in the bloodstream, we were talking earlier just a little bit, Bance, about the PFO like valves between the heart, and we can talk about that a bit in detail later. But you were talking about a bubble test where you actually inject kind of like a saline air mixture into the heart to see if the bubbles pass through the two vena cavas, right?
Yeah.
Yeah. So how?
The two atria, but yeah.
Atria. Sorry, atria. Yeah, that's the one.
It's the atrium and the I want to say septum, or is that the atrium?
Passes through the septum, right?
Yeah.
Yeah.
What are the two areas called again? My biology is very rusty.
It's well, there are 4 areas: right, left atrium, right, left ventricle.
Ventricle. I was gonna say
the-
ventriculum. I don't know why.
You can say ventriculum. Ventriculum is in Latin, so it's absolutely correct as well.
Oh shit! I'm actually I'm smart, so much smarter than
Latin
I
genius.
thought.
Boom. Joey with the big guns. But why doesn't that cause risk of thrombosis then?
Okay, it doesn't, because the way you do it, like you connect the two syringes on like it's a small valve, right? And it creates a hydraulic system. So you push the
I've heard
you
of
push the
this.
thing on one end, it pushes on the other, right? So you do that a lot, and it creates such small bubbles, right? And that in the end, they're not going to lodge themselves anywhere.
I think I've heard of that. It's
Right.
because the two halves of the heart kind of work in tandem, right? They open and close. So if you
Yeah.
do that, you're actually kind of maintaining the equilibrium, right?
Yeah. It's very, very close to that. Yes, it's extremely complicated. It's like
Yeah, I'm sure.
but in the proper way to understand, it's exactly what it was.
Okay.
But just that, yeah.
Okay.
That's really interesting.
So only the large bubbles would cause a risk of thrombosis then.
Yeah. Again,
Okay.
if you cut someone, fatty lipoembolus, like a fat embolus, might go and lodge itself somewhere else. Like it's what happens when you break your femur. It's very often in car accidents. You see that they would break their leg, and then they will have pulmonary embolism, which is like something blocks the arteries leading to the lungs, and then you have problems with breathing, and you die from that,
yeah.
or stroke, or anything.
That's often a
much.
big part. So I understand that it's the case with the brain, because I've read quite a few neurology books where you might have a problem in your leg and something that creates a brain problem. And
Yeah.
the whole body's fucking weird. Is that the same case
is.
with the heart? Like, say, I don't know, you got a problem with your dick, and then suddenly like you got a heart problem. Obviously, don't take the dick example to heart, but is it the same kind of deal?
But
I thought
You
it was
are
a cute mention, though. That's why I laughed. I didn't. It was it was cute. It's like it's like if I have ever a problem with my dick.
Not that I do, guys. I'm
No,
fine.
you're asking
but-
for a friend, obviously.
Yeah, for a friend.
if I have a weak heart, do I have a micropenis?
Maybe.
Could be.
Oh damn.
Actually, true.
I have no data on this. Anecdotally, probably, yeah.
Yeah, but
no,
yeah.
with
yeah.
with
I'm
the heart,
curious,
it's
so-
like it's.
So, like, just back to the question. So, is that how it works? Like, could you have a problem with, like, in another part of your body? Like you said, like, maybe it blocks one of the veins, like, connecting through the heart to the lungs or something. But is that common? Does that happen a lot, or not really?
It depends on where the problem lies, right? With heart, we have the arterial flow, right? We have the venous flow, and then we have the pulmonary flow. Sorry, my pronunciation is
That's
kind of.
okay.
I'm talking about the
Pulmonary
lungs flow. So there are 3 flows. Again, not exactly. Generally, it's the great circulation and the small circulation, but I'm just right. So if I create a problem in an arterial side, that means I am after the heart, right, moving into the veins. So I might cause an embolus in an artery, and you will see the typical cyanotic hands that have no blood coming into them. So
Yeah.
that will cause, like they always cause a downstream issue, right? With veins, it's a bit different. You have a deep vein thrombosis, you're gonna have a red limb because it blocks the blood coming out. So you will have blood coming in. It's gonna be like a bit
Swollen.
well, what
Swollen.
you call it? Swollen. Yeah, thank you. And hot because there's flesh water coming in all the time, but it doesn't drain as fast as it does. So
Right.
it's a before stream problem. If you
Okay.
just it depends where you have the embolus. But there are also again issues where you have the cryptogenic strokes, which is you have an embolus on the venous side. You will never find him in the arterial side. There's no way because you go through the lungs, so the lungs are the first to filter it and get it stuck there, right? Because it goes into these small capillaries and nothing moves past it. So there is theoretically no way that an embolus from the venous side gonna end up in the arterial side.
Okay.
But when it does, you have an open PFO, a communication between the two atria that lets the thrombus skip the circulation, like skip the lungs. And then you have strokes, cardiac arrest, cardiac infarction, and anything else you can imagine, like from limb problems, kidney issues, depending on what artery it will stick to, eye problems, everything. Like everything is on the table at that point.
Shit,
It's
okay.
scary.
That kind of leads me into another question too. So obviously, like with the heart and all the circulation, you've got the I can't remember if it's veins or arteries, but you've got blood going into, I want to say, arteries, and then the deoxygenated blood is like in the veins. Is that correct?
Yeah, pretty
Yeah.
much.
So if you have problems say in the veins, is that more difficult compared to say the arteries, or is it like the surgeries kind of similar between arteries and veins?
Okay, actually a good question.
Thank you.
There are there are distinct differences and problems, right? Like generally suturing up a vein, because always there are two of them. It's like Sith. That's why I remember. That's how I remembered it. Always two there are. There's also always almost two veins draining from somewhere. So theoretically you can obliterate one, close one, and you will be fine, right? You might be a bit more swollen, but it's not going to cause major issue. That's why we take a vein from the leg to put it as a bypass graft on a bypass surgery, right? We can afford to lose one vein.
I didn't know that. That's so cool.
Yeah, it's actually brilliant. The guy who thought, let's take a vein and use it as an artery, I'm like,
Yeah.
brilliant. Now, on arteries, it's much more complicated. You need to really understand the anatomy to be able to say, yeah, we can afford to lose. Like Circle of Willis, for example. Pretty sure you're way more familiar than I am with this. You can't afford to lose certain areas of it because they're going to be provided by the other areas. And that's why the circle is there to actually make sure the brain is going to be oxygenated no matter what. So that's fine. With the hand, it's also the same. We have a circle here that you can say, okay, I can lose that side of the artery. I'm going to have blood coming from the other two sides. But when you were talking about the arteries of the hand, that's way different. If you lose an artery from the hand, you need to make sure you somehow restore circulation because you're gonna lose muscles. So
Right.
it depends on the area. Now for the physiology of it, right? Arteries tend to have higher pressure if they're big ones, so it's way easier to actually tear if you puncture them or you just handle them in a way that they shouldn't be handled. Arteries are thinner, but they carry way more blood. That means if you have a leak somewhere or something bursts, the patient will die super fast. So it has a lot of nuances.
Right.
I would say personally I prefer working with veins than arteries.
Okay.
That's just a personal preference, though.
Yeah, because I remember from biology. This is like years ago, but I just remember because I did higher level biology to prepare for psychology. And the arteries are the big ones, right? And they've got, I want to say, less pressure, and then veins are smaller with higher pressure. Is that correct?
Other way around.
Other way around.
I think-
Sorry,
yeah, I
arteries
think-
bigger with high pressure, veins smaller with low pressure?
I would say arteries are thick. The walls are
They're thicker, right?
the walls are thicker.
Yeah.
The lumen, the opening, it's a bit smaller than the veins, right?
Oh,
Veins,
okay.
their walls are thinner. The lumen is bigger, and the pressure is way lower than arteries.
Oh, okay, right. Because you always hear about, say someone gets like stabbed with a knife or like they just like maybe cut themselves somewhere. You always hear that cutting arteries like that is worse. Is that true?
It depends which artery.
Like, you
True,
know, you always
yeah.
hear about like this one kind of.
Yeah, if it's a carotids, if
You're
if,
fucked, right?
Like,
You're just dead.
yeah, yeah,
Yeah.
yeah. Like if you start seeing this, like the
Yeah.
typical splasher, this, yeah, it's like okay.
And what
There's
about like
and
this
it
one?
does look
Like
like that, by the way.
right here? Like you cut that, you just fucked, or
No, you're fine.
you're fine?
You're fine. Yeah, yeah.
If you
Okay.
get to the doctor fast enough, right?
So where are
No,
the
you yourself, like, okay, if I may use it as a PSA, if you ever do this to yourself and
well,
you
don't
want
do
to
it.
stop, just wrap your hands very tight and run to the ER. You can save yourself.
Rub your hands well, like this.
Like, oh, not wrap,
Wrap,
sorry,
wrap.
wrap.
Oh, wrap.
Sorry,
Sorry,
just
yeah, wrap it,
wrap.
yeah,
Yeah,
yeah.
and-
Yeah, okay, that makes sense. So where are the most dangerous spots to like be cut? You know, if I'm just walking in London, I'm scared of everyone. I'm like, everyone looks like they're gonna fucking murder
anything
me.
around here is
Anything
dangerous.
around here?
Yeah, because
And-
you have this the jugular veins,
Yeah,
which
yeah.
are veins, but they are super packed with blood, right? And you have the carotids that are directly coming out of the aorta that gives you like high pressure, high volume blood that goes into perfuse the brain. So you do understand like it needs to be high pressure. So this area, like the most vulnerable area to get cut and die, it's the neck.
Okay.
And can I also, as a layman, think leg? Like if that big vein in the thigh?
Okay, the safina magna on the inner side of the thigh, right? There
Yeah.
are the femoralis vein, the femoralis artery. There's a bunch of it, but they're really deep. But
Okay.
superficial, there's the vena safina magna, and it's bit north of your crotch. That's where it comes out from the area.
Is that what it's for? Oh, never mind, never mind.
No, please.
Like, well, it's like a bit of a crude question, but I don't even
Yeah.
want to ask it. Continue.
Okay.
It's not for YouTube.
All right.
I'll ask you after.
Yeah, feel free. If you cut that one, you can put pressure on the vein. You shouldn't be scared to put pressure on veins, right? It's like you shouldn't be scared to put pressure over any wound. Direct pressure, it's almost always fine. No, always better than no pressure. There you go. I made the difference. There is a nuance, but in doubt, just keep pressure. That's it.
Okay. Cool. That's really
It's
interesting.
half the job.
Okay. I had one more question. This one's maybe a bit like
Careful.
deeper or like maybe emotional or something. But
Yeah.
have you ever had a patient die on you?
Yeah.
Okay. What was that like the first time? Like, I'm guessing it ruined your day.
It ruined my month. I legit like started sessions with the hospital psychologist. I don't like psychiatrists, so that's just me.
Most psychologists don't like psychiatrists either, so don't
Yeah.
worry.
Yeah. Okay, so
No, I
there you
actually
go.
didn't know a difference between the two until like recently.
Yeah.
Oh, yeah,
So
there's-
for those of you who don't know on YouTube or the stream, a psychologist helps people with mental health problems or without, but they specialize in mental health. So a psychologist helps people with mental health problems through talking therapy, and that may range from something like cognitive behavioral therapy to psychoanalysis. Whereas a psychiatrist is mainly there to prescribe medication for mental health problems. So psychologists give talking therapy, whereas psychiatrists give medication, and psychologists are not allowed to give medication. So oftentimes they work in conjunction with each other, but the way they actually help people with mental health is very different.
Okay, interesting.
So yeah, finish your point, please, Minas.
Yeah.
Yes, sorry.
It wasn't a nice. I don't think anyone. You don't have to be a surgeon to do that. You can fail, like even as a pathologist, as a first year.
As a psychologist as well.
doctor. I mean, yeah. I mean, if it's, I would never be able to do this psychology part because I would be scared that if I fuck up and he suicides, that's all. That would be always in my mind. But yeah, I guess it's a bit more direct with us because okay, you cut something wrong, he died, or you didn't see something, he died, or you misdiagnosed something, he died. But again, it was heavy. It took me down.
So do you mind if I ask, like, how did it happen? Like, where was the mess up, or was it just unfortunate?
It was a bit of delayed arrival at the hospital.
Oh,
It,
okay. So nothing you could really control anyway.
yeah, yes, I mean, yeah, it wasn't a medical error if that was the thought, but it's you don't want to see a 35-year-old dying in front of your eyes.
Yeah, right. No, of course, that'll be horrible. That's very young. What happened, if you don't mind me asking? Oh, and of course, if it's too sensitive, please, you don't have to answer.
It's a drop from height, 3 meters, 3 meters drop.
Oh, he got dropped, or he fell? Or?
Yeah, he dropped, and it created the pericarditic fluid, like blood going into around the heart, and which caused the tamponade, and we weren't fast enough to make a window to drain the blood.
Oh, okay.
Yeah.
So does that happen only, like, say you jump or fall from like 3 meters? Can that happen just from the impact, or do you have to like fall like on your side or something?
The impact does play a role, but the way the anatomy is of the heart, usually the issues here, you see it when the aorta, like let's say this is the heart, right? The aorta comes on top of it and does this arc, right?
Mm-hmm.
The aortic arch. The aortic arch is stabilized on the, let's say, on the back wall of our chest with a tiny bit of connective tissue, right? So on impacts, that happens a lot with car accidents. The aorta tends to move forward, while the tiny thing holding it, the connective tissue holding it, stays in the back. So by pulling apart, it creates a tear.
Okay.
Huh.
So and that tear might leak into the pericardium and strangle the heart with blood. Right? Imagine a balloon an inflated balloon in water that you keep increasing the pressure of the water. Like keeping it that, it will crush the balloon.
That's a good analogy.
Yeah. So that kind of messes up the whole thing. You see it usually in car accidents.
Okay, yeah,
because typical for a fall. For fall, you're gonna usually lose kidneys or liver, most likely.
Because similar things happen in car accidents with the brain, right? Because the way it works is like your head goes forward very fast, and so what happens is your brain actually, I think this is correct, you could say if I'm wrong, but your brain like smacks the front of your head and then goes back, and the rattling can actually kind of fuck up the blood flow. Exactly. Yeah, concussion pretty much. Yeah. And if that's like 100%. Strong enough, it can like damage parts of your brain, because obviously it's not meant to move. So
the only different thing with the brain is it's not firmly attached to anywhere. Like obviously you have the meninges and everything and the sclera to keep it close together, but you don't have attachments on the skull itself.
Yeah,
it's free flow. It's like kind of floaty, if I remember correct from my
I'm not,
there's fluid in between.
I should know this better because I've done a lot of neurobiology, but I want to say, is the brainstem connected to anything, or is it not? Because that obviously feeds into like if you damage the brainstem, then you get spinal problems and whatnot.
Yeah, I mean the brainstem would probably kill you because it controls breathing, heart,
a lot of
heart
shit.
rate, everything. Like a brainstem, if you manage to pinch it, it's pretty much a goodbye, right? It's just like
Pink. Actually, I think it was Pink. You told me this recently, or maybe it was someone else. Wait, no, it was my good friend Jono from Australia, and he told me, I didn't know this, but you can just die from being punched in the face. Like being punched in the head. You can just straight up die.
If it damages your brainstem, absolutely.
But not just your brainstem. Like even if you punch someone hard enough in like the jaw, like the head, like you can kill them.
Yeah. Funny thing, when I was learning Taekwondo a little bit, right? We weren't allowed to hit each other here, right? Because apparently
that's really bad.
There's a thing here where there's a nerve there. If you punch it, you can get knocked out or like cause, I don't know what it is, some kind of neural overload maybe or something, and you kind of just go.
Okay. Yeah.
I don't know honestly what it is, but we were told
like, really bad to get punched too.
I know this area. I know the facial nerve comes from, right? This is coming at the end of the ear, right?
Isn't it
on
behind the ear where it's really bad as well? Like right behind the ear.
I know here is very bad
Yeah, that too.
as a hit. Yeah, obviously back of
Big
the ear
headache.
as well, because if that area cracks behind it, there is a meningeal artery, and if you crack the skull at that area, it will break the artery and it will cause you to bleed inside the cranium, inside the skull.
Yeah, I like this because Pink and I are just like, yeah, this is no good, bad. And then Venus is like, yeah, because here as well, because then you crack the meningeal artery and internal bleeding. We're like,
You learn that, man. It's
of course.
yeah.
It's really
Made me
nice to have
scared
an
'cause
actual someone who knows what the fuck.
Yeah, because I've been doing martial arts for like 8 years now. And I did a lot of karate, and then over the past like 4 years, I've been doing boxing and Muay Thai quite a lot. You know, with the exception of this whole lockdown thing. That shit's scary. And obviously, you know, you're wearing gloves and stuff, so it's not too bad even if you get punched or hit. And honestly, the most painful stuff is getting punched in the liver. But it's scary. Getting punched in the liver fucking sucks. Oh my god, I was sparring against one guy maybe like a few months ago before this, and really good boxer, and honest, like better than me despite my height advantage. And he stepped in and got a really insane body shot on my liver. And like you don't even have it's not like where you get punched and you go, oh, I'm gonna push through this. It's literally just your body stops working for a second and you fall, and it's fucked. I saw this video on YouTube once about how like why liver shots are so deadly, and it like you literally see the liver moving and it kind of bounces into your like rib cage or something. And it's
from anatomy it works.
And like the effect that has on like just like your perception and like maybe dizziness or something. It's really crazy. If you punch hard enough in the liver, you can really fuck someone up.
Yeah,
You
and
could
correct
kill them,
me.
I would argue.
You know, you
could.
can
Correct me if
destroy
I'm
their
wrong here,
liver.
Minas.
They
But,
bruise really easily.
If you think about it, right, the liver is kind of like a sponge, right? Like the tissue is quite soft and stuff. So, but at the same time, if it gets deformed too much, it can do damage a lot to it. And the kind of impact that's delivered to the liver is not very affected by gloves. Like it is affected a bit by gloves because the glove causes a slowdown of the fist as it impacts, but the total amount of energy delivered isn't changed that drastically. So because you're not talking about surface impacts where, you know, hard fist knuckle impact is the one that matters, like bruising and smashing. The difference between getting punched, someone wearing gloves or not, isn't that big when the liver's concerned.
I think like I see where you're coming from and I agree, but I also think that if you don't have gloves on, you actually get a bit deeper and you're going to be hitting the liver more. So that's going to have
there is going to be a difference, but what I'm saying is like if you're going to die from being punched in the liver, you're going to die more quickly from no gloves, but at the same time you can do damage with gloves still.
All right.
All I'm gonna say is that like I wouldn't want Mike Tyson to punch me in the liver even with gloves.
Wasn't it Houdini who died from a liver shot?
I don't even know.
The
magician Houdini?
I think Houdini died from getting punched in the liver. I think that was the thing.
You better fact check that.
I better fact check that.
You better fact check that. But like if I would bet, I think the problem with well, not kidney shots, sorry.
Kidney shots are even more dangerous, and that's why they're banned in boxing.
Yeah. But like I think the problem with kidney punches are how much you deform the liver, because the liver has a membrane that splits it to right and left liver. Anyway, it doesn't matter. There is a membrane that attaches to your Zwerchfell, to your diaphragm.
Oh yeah,
okay.
Yeah.
So if you punch too hard and you force it to, bend too much, there is a good chance it's gonna tear, right? Because I think there was liver is such an interesting organ. I think at any point it has 25% of the blood in the body. It's in the liver. There were even research studying whether or not we should do CPR on the liver rather than in the heart. So that's how much, like, obviously it's not, you shouldn't do that. It was proven it's not a good idea to do that.
Imagine you woke up on the scene. I'm a doctor, don't worry.
That's the liver.
It's like, what the fuck are you doing? Don't worry.
Yeah.
I'm qualified.
But that's how much blood is in there. So if you tear it, I would imagine, I don't know, right, guys? I'm just like, but I would imagine if you tear that area, it's way more dangerous because of bleeding, rather
Yeah,
than
internal bleeding.
anything weird effect, like, extra pressure coming up into the heart and stuff like that. Obviously,
Yeah.
that could be a case as well, but I would bet it's mostly bleeding because of liver rupture.
Yeah, and that's the reason it hurts so much because and it's because you don't need a lot of force just to hurt someone by punching the liver. You can literally just do that, like really short motion, and it fucking hurts. If you get a massive punch into someone's liver, then like you could, like if you watch the actual anatomy of it, like physiology and how it works, it fucking moves around like that. It completely shakes, and you can really damage it like that. It doesn't take a lot of force at all to hurt some of that.
You're
So,
100% right.
It's really, but kidney shots are more dangerous. I can't remember why, but obviously the reason is you have to kind of hit from behind, like in the back, kind of to hit the kidney.
Kidneys are more, they're less stabilized, right? That's why if you jump from a high place and land on your feet, liver kidneys are the first that just goes into your anus pretty much because they just tear. Because kidneys are really not stable enough, and they do have ample blood flow. Everything that goes, like, if I could magically remove your kidneys right now, right, without bleeding and anything, you wouldn't notice until 12 hours later, right? That something is going very wrong with me. Even more, right? So that wouldn't be that bad. Obviously, with liver, I'm not sure how fast that would be, but you see people without kidneys going into the dialysis machine every 24 hours, 2 days even, right? So you wouldn't see it immediately. So I guess it's more of a bleeding problem. And if you tear these huge arteries that goes into the kidneys,
you're fucking dead.
Yeah, that's it. It's bleeding death. That's it. So that's why I think it's a bit more dangerous without exactly reading, just from just feeling pretty much. I just assume that's
educated
the case.
guess. I trust your educated guess better than mine.
Oh yeah.
Okay. Yeah, I don't. I guess.
All I know is that
I haven't done martial art in my life, so.
Yeah, fair enough. So, I mean, I don't know, Ping, do you have anything else you want to talk about with medicine? I'm sure we'll jump back on it later, but like,
there's so many things in medicine, man.
You can never finish off. I'd actually love to listen to the other side of the story because, as a doctor, you keep giving bad news and stuff, but the impact of them, it usually eludes you. Yeah, you see them crying, but you never deal with the depression, which can be actually worse than everything else, or
fair enough.
other problems that might develop. That's more interesting to me.
I guess the good part about being a doctor is like someone comes in, if you don't fix them, they're gonna die, and then you fix them, they live another 50 years. That's gotta feel pretty rewarding. You don't see it.
Yeah. Like,
before you know, they got hit by a car the next day. Fucking idiot.
Yeah, pretty much.
I mean,
happened a couple of times.
Oh damn.
Doctors and healthcare
operated
professionals.
a guy 6 months later. He went skydiving, and you're like, yes, okay, fine.
What happened on the skydive? Did his parachute not go? Or?
Parachute didn't open.
Parachute once.
Wait, what? What was that?
The parachute malfunction.
Oh, that's why I'm never going skydiving, dude.
Yes.
Because if your parachute doesn't work, that's just the worst death in the world.
You just are like, oh no, please.
I'm not sure if it's the worst though.
Okay, it's not the worst. Like, there's definitely worse deaths, right?
It's bad, but like.
That's just like what 2 minutes of you falling
in
in the sky, thinking I'm fucking dead.
Yeah, but you can probably text someone and say "I love you" before you die.
Yeah, true. I mean, I know there's a story like years and years and years ago of this one like Australian guy, I think, and he was skydiving and his parachute malfunctioned and his backup parachute malfunctioned too. So he really got fucked. And he actually survived, but he was doing an interview or something. He said like, I wasn't thinking, my wife, I love you so much, thank you. I'm sorry I have to leave behind my kids. I'm thankful for this. He literally just went, fuck, I'm dead. And then he landed in a bush of thorns and survived.
Oh, thorns.
But he survived because
I'll take them any day instead of death. Like,
me too. I'll take a few cuts and some broken bones, but
yeah.
Yeah.
Actually, my stepfather was in the military, and he told me a story about a military parachute jumping tests that they were doing, and there was a guy who was at the end of the parachute line, so there was like 50 of them jumping out of the plane or something, like one by one in a row. And the very last guy that jumped, or like close to the last at least, his parachute didn't quite work, but it like slowed him down a bit. But when he landed, he didn't like roll; he just like landed, and
Oh,
his shin snapped, and the
Yeah.
shin bone dug into the ground, just like thunk.
There is there is a fracture in orthopedics. Again, not my area, but it's a fancy name I really like. It's a spiral fracture, and you see that very often. Like it goes like you imagine, and you see that very often in people who do skydiving and land stupidly wrong. It's quite amusing. I had a first hand
Amusing.
experience. It's amusing because like in because in Cyprus we have to do 2 years of military service. We do this shit, and they tell us don't try to be heroes. It's better if you fall on your face rather than just try to stand. Try to when you come down with the force, move a bit. That's why
you're
you see
supposed to
them
run,
running
right?
instead of just huh?
You're supposed to run, right?
Yeah, that's what you're supposed to do as much as you can. But it's better even if you can't run, just fall on your face rather than
Yeah.
just stand and stop it immediately, right? Because then you have more area to distribute the force if you fall on your face. The guy tried to stand like this, and he went like, whoop,
Oh.
and the leg was mangled.
Did he?
Nothing protruded, not like what Pinky said that the whole shin went into the
Do you
ground.
recover from
But
that?
on the X-rays was like ribbon.
Do you recover from that or no?
Depending on how good your orthopedic is and how lucky you are and your age and how fucked up and the height and it's so many things.
Okay,
I
yeah,
would
there's
say
a lot of
no.
variables. Yeah.
But no. Like,
Is that the same with
probably not.
skateboarding? Because I knew this guy when I was in school, maybe like when I was 13, and he was in the grade below. And I guess he fucked up a kickflip or something, but both of his, I think his bones or his shins were literally sticking out of his legs.
That's a big fuck up. I used to skate, and like I've seen some injuries, but never anything like that.
Yeah, like it was literally sticking out of his leg or something. Like not a lot, but you could see it, just the tip point like extruding out. I was like,
He must have done some like either like height stuff, like going off of stairs or something, or maybe like even ramps. There's no way
I can't
that
remember
happened
what,
just a
but
normal kickflip.
he really fucked it.
That's crazy though. Fucking hell, like
That this is why I will never skydive because, like, yeah, sure, like Leon has gone skydiving before, and he was, I think, our last guest on the podcast. Oh no, yeah, he was, and yeah, he said he had a great time. But honestly, I don't want to jump out of a fucking plane. Like, that seems just like a suicidal thing to do. I don't care how much adrenaline I get. I'll just wait for my weekly chest. Like.
But you know what's the most fucked up part of that story? Apparently he had to sit there. Apparently the guy who had his shin bone stuck into the ground, he had to wait there with his leg at an angle and his bone in the ground for like 20 minutes before they picked him up.
Imagine the
That's
things
a bit-
going in your brain there, like, holy shit. It's like, oh, I'm just not going to be able to walk anymore.
Yeah, they're probably not gonna be able. That's a realistic thought that they have. Then
Yeah.
it's a bit too late, but I guess.
That's
The
crazy.
thing that really screws me up about that story and like is that think about bones are hollow. Well, they're not quite hollow, right? They have bone marrow and stuff, but the soil goes in there. It gets compacted.
Well, I actually think I wanted to say this before, but I forgot. But with bone cancer, isn't something they do with an operation? Okay, my English is bad there. Don't they do an operation with bone cancer where they pretty much extract all the fluid or something inside of your bone out? And it's apparently the most painful kind of surgery or process ever because I think you have to be awake during it.
The bone marrow thing, yeah.
The bone marrow, yeah, bone marrow transplant. Is that it? I don't know if that's with bone cancer.
The transplant itself, it's not that complicated. You connect the bone marrow to a vein, and it ends up in the bone marrow area, right? In the spongiosa of the bones. Extracting bone marrow can be very painful for the donor, right? But like to keep you awake. They do
I've
keep them
heard.
awake,
Yeah.
more or less. They do keep them awake. Sorry.
Yeah.
No, like to my knowledge, at least, I'm not aware of any operation that. I know operations that you have to be awake, and they're on the brain to see if they fucked up something.
Yeah, I've heard of those
But
too. That must be
yeah.
weird as fuck. I'm guessing. I don't think you feel it though, because you don't really have nerves on your brain, do you?
No, you don't. You feel slight tingling sensations. That's
Yeah,
what
right.
they sometimes
You get the
express.
same thing with electrocranial therapy, I think. Where it's a very very specific and particular therapy for depression, where they pretty much stimulate your brain with electricity.
Yeah.
And yeah, a lot of people report feeling tingling sensations or something like that.
Isn't that
Also-
what one of our previous raiders had, Minas?
Yeah, he was doing that. It's very much a last resort when
Like the one
medication
that
and
was
talk
really
therapy doesn't work.
suffering from it, actually.
Yeah, I mean, I'm not gonna say names, but I can't remember his name
name.
to be honest. But yeah, I remember
No, I
him
think
talking
there
about
was someone else that was it the druid, Minas?
Yeah.
Yeah, it was a druid. See,
I think he had a vagus stimulation module.
right.
Okay, I
They
don't
do
know.
an operation and they try and stimulate the vagus nerve because in some cases it has shown that it actually helps.
Okay.
No clue if it does. Like I haven't really looked into it. I've seen the operation myself once on the rotations way back then. I mean, 6 years ago or 7 years ago.
Okay.
And that was it. So I'm not sure how that works, to be honest.
Yeah, different from electrocranial therapy, but
Yeah, definitely.
Yeah,
Like from
yeah.
what I've seen from that therapy, it's like it's a surgery process, and you add like a defibrillator on the vagus.
oh
pretty
wow.
much. Yeah,
Okay. Yeah, because like I guess going to psychology a bit now. Why didn't you mentioned before that you had to see a psychologist, after your first patient died.
Yeah.
But why didn't you like the process?
I'm a very private person. Like when when it has to talk about like general things, I have no problem discussing. I really love discussing, but you can ask even Pink. I know him for that many years, and I may have mentioned that I'm not good once, and it's one of the closest friends I have online, and I just don't like talking about things that really like make me sad or annoy me or make me angry. It's like I don't want to reveal emotions generally
Okay.
to people. So it's just like it's a character thing. I don't know if maybe I don't know, maybe it's something deeper that I haven't really explored, but
It could
not
be,
my
but I don't think we're in
yeah.
a place to assess that necessarily because it takes a lot of information only to get that out of someone. Do you know if it was like CBT or psychoanalysis or MDT or something? Like, do you know what type of therapy it was or no?
I think I don't really know what the abbreviations were, but I think the psychologists were suspecting a PTSD type of thing.
Okay, no, that's not what I'm
Because
talking about, but fair
he
enough.
kept asking like and checking about my blood pressure and heart rate, so he was either thinking of I don't know, a stress disorder that settled in suddenly or something. It was very weird. I was like, okay, am I being targeted for that? Like it felt
Oh,
like I was
okay.
trying to be shoehorned into that box
Into a category,
because
yeah.
it fits most of the So I don't know, but I do think about it occasionally, but I don't have any physiological
Okay.
manifestations.
But do you know what type of therapy they were using or not really?
No,
Okay.
I just sat and talked for a bit. That's it.
Right. I think because that's a very large misconception among people that don't study psychology or know about it, is that they think it's just, you go and sit on a couch and talk to someone and then they diagnose you and, you talk it out. But it's actually very different than that. You have like
There are a lot of schools, right?
Yeah, you
Of
have a
approach.
lot of different paradigms just within psychology, right? You have criminal psychology, forensic psychology, clinical psychology, social, organizational, developmental, geriatric. You have you have different disciplines over all of like whatever fucking branch you want, right? But then even
Yeah.
just within clinical psychology itself, you have so many different ways of giving therapy. You have existential therapy, you have cognitive behavioral therapy, you have behavioral therapy, cognitive therapy, mindfulness-based therapy, acceptance and commitment therapy. There's all these different ways you can actually help someone. Some of these are better for certain mental disorders, and some are just good and maybe better overall, right? But I think a lot of people don't know that there's this like really big difference, because if you're going to someone, or if you're going to a psychologist and he gives you psychoanalysis, and you're just like kind of, and it is making all these weird inferences, and it's asking about your childhood and your relationship with your parents and whatnot, then it might make you really uncomfortable. I'd say especially if you're a younger person or a bit more like kind of in the modern era, but you know, like, and that might give you a really bad representation of what psychology is like if you prefer something which is kind of the opposite, like cognitive behavioral therapy, which is essentially the psychologist and client working together and forming these kind of problem solving like adaptations and techniques to help. So it's much more about addressing a problem rather than talking about like, you know, your past experiences and stuff and trying to like discover yourself. A lot of people, like, I don't know, really don't know the distinction, and I think it's really important because the way you actually approach mental health changes so significantly between these different therapies. So
I guess they're like, sorry about the very crude comment, but it's like if I have a nail, I'm gonna use a hammer. If I have a screw, I'm gonna use a Phillips screwdriver. It's like you need to pick the right tool for the job. Am I
exactly.
way too far off?
No, I think you're right. It's like some people are just going to prefer some types of therapy.
Okay.
And obviously, like your rapport or you know bond with the therapist is going to be really important. But some people like don't necessarily need, like, okay, like I'll just give like a case study example, right? Say someone is scared of going to the toilet in public, right? They can't use the urinals. I think it's called paruresis or something. It's a real thing.
Well, it sounds really Greek, so I guess it is.
Yeah. But I think it's called paruresis, and it's a really common thing, right? And if, say, because you can't go, like, you can't use the restroom in public, you stop going to university and you stop hanging out with friends because you're afraid that if you're going to have to piss while you're there, you won't be able to. And that gives you anxiety. And then because you've fallen into these habits of not going out, you become depressed, right? So there's this overarching issue, but then you've also got these other mental health problems as a result of that. If you see a psychoanalysis, and like I might shit on psychoanalysis a bit, but it's not really the point. Or if you see anyone else, right, like, but let's just say psychoanalysis. If you go and do psychoanalysis, then it's not really about just fixing the problem, and it becomes more about like maybe like self-discovery and meaning making, which is a very long process, and it's expensive and it takes a lot of sessions. And maybe it will work for some people, right? But if you really just want to like get over the problem, or whether it's a phobia or anything else, and you go to a cognitive behavioral therapist, then it's literally just a fixed 12-week period where you do one weekly session, and then it's, you know, forming these self-help techniques to get over that. And then by the end of it, you hopefully just you hopefully just don't have that problem anymore. I think it really depends. There's like such a big difference between different therapies. It's really important. Like, I can give another example as well, just very quickly, not like the other one. So a lot of therapies revolve around meditation and mindfulness and that kind of stuff. And I fucking hate it. It doesn't work for me, and I've tried it. And it
I was
just
gonna say that
weird.
they are shit. I was like, no, don't say anything about this. I don't like them either. But yes, please.
Like, they're not shit, and they definitely work, right? But it just doesn't do it for me. And I can't ever see something like that being a way that I would even want to get over a mental health problem if the time ever came. But some people love that shit, and it works really well for them. And I think that's a good distinction, because you have those therapies where that's like a really core part of, you know, fixing the problem, and then you have other therapies which go, no, that's stupid. I think it's good, you know?
Actually, can I ask, this is really not proper psychology related, this is like pseudoscientific psychology bullshit, but what do you think of those kind of self-help books and like mantras and shit that's just like, yeah, like it's kind of in the same vein of the meditation and mindfulness, but it's not a proper technique. It's those people that have no degree, no real knowledge, and just like tell people to, you know, dig deep and do shit. Like, that seems really harmful for the whole field of psychology and psychiatry even.
I've got, like, I guess mixed opinions on it, because I want to say that if someone reads a book like that and then they're going through mental health problems and it works, then that's fine, right? But for those like people writing the books who maybe don't have the knowledge and are giving advice, then they also have the responsibility, and kind of the expectation that it's not just bullshit. And like, sure, maybe it's a case where it helps them, so they think it can help others. But for like people reading the book and it doesn't help, then that kind of sucks.
Okay, so a short example that I have on that because it's really important. We had at some point a vaccine for AIDS, right? It was 60% efficient and good and was protecting, but 60% is way too low, right? So what the scientific community did is it didn't accept it as a treatment or as a prevention method just because it's not good enough. So the books might be helpful. I'm not gonna put any ill intent on the people writing them, right? But again, I wouldn't suggest that because if you're trying to help, you should try with the most likely chance, the treatment, anything that's most likely to help the patient. And when you have exhausted every other thing, like there is nothing else in the books that you can do, then I mean you're losing anyway, so you have nothing more to lose.
Yeah.
I guess again, not exactly true, but yeah, there's always something to lose. But then you maybe try something like that.
No, I agree with you. My kind of take home message for that was going to be that, if you've just got like, if say maybe you're just a bit sad or confused about life or something, then sure, maybe one of those self help books can help because it can be quite vague and generalizable, right? But if you really have mental health problems and you're struggling with it, then I would never recommend going to those books first because you should be seeking the help of a psychologist or psychiatrist.
Proper like professional help.
Exactly.
It's the same thing, right?
Like-
If you have a headache, you don't just go to a crystal and start doing crystal or read a book about headaches. You go to a medical professional. The same thing if you have a mental condition, which is 100%. I would include it just out as an just respect. It's like it's a medical condition. I'm just putting everything under that
of course
umbrella. You need to see a professional. That might be a psychologist. I prefer psychologists in general other than psychiatrists because they're a lot more of the have a drug and let's talk against something. Some of them do psychotherapy and all the methods that you're mentioning, but it's way better to talk to someone that has only been doing the talks. I'm just putting it again as a gross generalization.
I'm inclined to agree with you.
Yeah, I've seen myself, like if I went to a colleague and say, hey, I need some SSRIs, I'm just getting some stress all the time and I don't feel happy and I just kind of feel down all the time. That really doesn't work. It works way better with me if I have
wouldn't
a
recommend just taking
person to talk to.
SSRIs.
Huh?
Yeah.
It's like, I'm feeling really down and now I just feel numb.
Yeah, it's okay, good. You've buried everything. Great job. Just wait until
It's
they
like,
pile up again.
I'm kind of taking this analogy from a song, a really good song by a rapper called NF, and he has a song called Mansion. And pretty much what he does is he takes all his burdens and the things in his life and he represents them in this house. So he goes, I go downstairs and then you get the uncut version of what goes on in my mind. And he's got like these different rooms for these like, past tragedies or events in his life, which he tries to hide. But, and he says one part in the song that instead of trying to fix the walls, he just repaints. And in my opinion, that's kind of what medication is like. And obviously it helps some people. And if you're depressed or have anxiety and you just need to take medication and you feel completely great, then that's perfect. But in my opinion, I feel like medication is just more like repainting instead of fixing the actual issue. Whereas the talking kind of therapy is actually fixing the infrastructure and addressing that.
Doesn't that depend though? Because there is mental health. As far as I understand it, again, not professional. I'm the complete layman here. You two know way more than that because you do medicine and psychology in college, and I'm just culinary. But as far as I understand it, there is basically physical. There can be like a physical-based depression or mental illness, like where there would be, hormonal imbalances or serotonin imbalances or something like that.
Yeah, neurotransmitter
and then. Yeah, neurotransmitter imbalance, and that may not have a direct talking, working through your issue kind of approach, but rather needs medication, right?
No, you're
Is
right.
that a thing?
But the thing is, and it's like way more complicated. I guess kind of like what Minas was saying with heart surgery and stuff. But the main reason like I gave the general statement is because we don't just have like this fucking machine we can plop you in and go, okay, this is because you because of life circumstances. Sorry, we can't just say, oh, you're depressed because of life circumstances, or oh no, you're depressed because you have a like neurotransmitter imbalance. All we know is
Sure.
that if you come and you say depressed and you match the symptoms of depression, then all we know is that you're depressed. And like obviously we have these theories for depression, and it kind of generalizes to all other mental disorders. And that theory is called the diathesis stress model. And what that kind of posits or says is that mental illness kind of forms normally as a result of either environmental factors or genetic factors, but most of the time, I would say it's going to be a combination of both. So I think a great example is like schizophrenia, where we know it has a strong genetic component to it. If you have an uncle, like a first degree relative or something that has schizophrenia, then your chance of having schizophrenia is far higher because you're going to share some of the same genes. But just because you have those genes doesn't mean that it's actually going to activate and give you schizophrenia during your lifetime. But if you go through some negative life events, or you have these environmental factors which kind of reduce your quality of life and make you stressed, then the chance of that gene activating actually increases. And so normally what we see is a situation where people have both a genetic predisposition and environmental factors which influence the activation of that gene. But it can also be the case where you just have absolutely no genetic marker for schizophrenia, but because of
spontaneously.
and it spontaneously appears because of these life events and environmental factors. So the reason it's called the diathesis stress model is because the diathesis represents the genetic predisposition to a certain mental illness, and then the stress represents the environmental factors. And normally it's going to be a mixture of both of them.
Right. Okay.
So
Yeah.
With medications, the way I see it, like it's if you're too deep in your well, you need something to bring you up high enough to be able to communicate the problems you have, right? So it will like the medication will bring you up to the point where the psychologist can reach you and just pull you up. Maybe it's an over romanticized version, but that's how again, the problem, even if you have depression, right? I would dare say it's a symptom. Okay, I'm using it very loosely. It's like other issues cause you to reach the depression stage, right? The pain, it's a symptom.
Okay.
Mental pain. You're gonna say depression is pain, right? So it's a symptom of what happened before, and the psychologist, the drugs will gonna alleviate that symptom a bit, and the psychologist would try to figure out what's happening.
yeah, I think that's a good
Again,
analogy.
simplifying like crazy because I've no idea about the field in general.
Like,
but
it could be the case, right, where someone is depressed and they go through talking therapy with a psychologist for years maybe, and it just doesn't work, and then they go on SSRIs or clozapine or something like that, and they feel better, and then they go on with their life, and it's fine, right? Like those situations happen, right? So it's not to dismiss that like depression doesn't form purely of a result of like neurotransmitter deficiencies or whatever, but it's also really hard to measure, and the pathology behind like medication and stuff is really complex. It's not just a matter of like, oh, you need a bit more serotonin, right?
it's a whole axis, right?
Yeah,
it's a whole axis. It's
like there are multiple and I'll bring this up later when we talk about sleep a bit, but a really good example is like histamine, right? You can kind of up the neurotransmitter of one specific histamine receptor, like H1, which is very common in people with schizophrenia, H1 receptors. But then you might completely change the balance in the H3 receptor, which can have other implications. So it's not just a matter of someone being depressed having too low serotonin, because you can't just raise it. If you're changing something somewhere, then you're going to be changing it somewhere else, most likely. And again,
it's a big interconnected crap, isn't it?
And I'm really not an expert in the medication side of things, because I've studied it loosely here and there throughout my degree. So maybe other people will know better, and I could be wrong. But my take on it is that yeah, like it could definitely help people, but I don't think it cures depression necessarily. And that's kind of my stance on it. And even if I'm wrong, that's how I feel. I think it's kind of like what Mina said before, where it can really help alleviate the symptoms of depression. Like you have a headache, then you take a fucking Panadol. But if you're having headaches all the time, then it's probably going to be the case that there's a root cause somewhere else, and that's where the psychologist can come in and help. And it might be things that people didn't even know was happening beneath the surface. And that's where like psychoanalysis can be really great, because oftentimes with people, and especially with trauma, there's the case where you've just really suppressed something, and when you talk about it, you suddenly get these memories back, and you actually emotionally process the situation, and it changes your way of being. And that's like, I'm not saying that's always the case with depression, because it can just be that your life sucks at the moment, right? So it's not always just trauma and stuff, but I'd say that the talking aspect of it really aims to address the root issue, whereas the medication normally just suppresses the symptoms.
Right.
That's why some people hate the medication too, because like something you hear is that people taking maybe SSRI medication for depression is that they feel fucking miserable when they're depressed, but when they take the SSRIs they just feel numb, and they'd rather feel something than nothing at all.
Yep. Yeah, I've heard that in a couple of Beerdigungen, funerals. Where, sorry, guys, it's been a long day. Where I gave SSRIs to my aunt because we lost my uncle. She asked me for it, and after that, she regretted it so much because she didn't have a proper closure of the whole thing. Like, she didn't feel it to feel like, okay, my husband is dead, right? She didn't feel that light subjects, but like she didn't have the closure of the pain that, oh my God, I lost my husband. She didn't realize it. So that was a very dumb fuck mistake that I did. Had no job giving that. And yeah, it's exactly what you said. It's like it makes you numb, and it makes you feel scared that you cannot feel anymore, which is even worse than depression. I would take depression any time of the week instead of just numbness. I think that's pretty much geistliches Tod.
Death of the spirit is what
death
that
of the spirit. Yeah.
It's
that's a hard one though,
not great
because
either
that seems very subjective though. Like, I know that there's probably some people that are just like, oh, I just don't want to feel anymore as well.
You hear a lot of depressed people say that for sure.
Again, though, okay, I have a weird question, because I'm okay. So I feel that depression is becoming a type of a fab. Like, oh yeah, he has depression. It's like, okay, not everyone who is sad has depression. Like, sadness, I think you can correct me, you're the psychologist here, it's a normal reaction to something that makes you sad. It's a normal thing. It's not like, oh, he's sad, he has a depression. Like, you see people losing their loved ones, and for 6 months, depending on culture as well, they go into these really like sad times in their lives, and then they bounce back. But during that time, they're depressed. They went through depression. It's not really that. Right?
Okay,
It's not
so
every.
I both agree with you and disagree with you.
Okay, please.
So in the sense that it's becoming a fad, I do kind of agree with you, because I mean, one thing you learn just doing clinical psychology is that you're not supposed to self-diagnose, and a big reason is because with these neurotic disorders, which are pretty much the kind of mental health problems we can understand. You have OCD, PTSD, depression, anxiety, that kind of stuff. It's based on emotions that we all feel, right? And so, like, where do you draw the line between sad and depressed? Obviously, we have like stringent criteria for that. We can we can kind of check the boxes. And whether it's becoming a fad, I don't know, because it could certainly be the case that it's just becoming more accepted to have mental health problems, and so more people are opening up about their depression, and it could be that this is just the actual amount of people having it. But I think I may kind of lean on your side a bit more that it is just people maybe attention seeking sometimes, and that it is a bit of a fad in a sense, you know. And you see people saying, oh, I have anxiety and I have depression, and it's not really my place or anyone else's place to discredit that. But, you know, whether it's actually true is something I think about as well, because
I have an interesting point of view on that, actually, if I'm allowed.
sure,
Again,
oh, I guess you say yours and then I'll finish the question.
no, go finish because it's the same. It's the same track.
Okay,
Go for it.
so yeah, so like whether or not I actually think it's a fad is something I'm not sure about, but it definitely does seem but you definitely do hear more people at least saying they have depression, anxiety. And with the other aspect of that question, when you said like, okay, someone loses a husband or a loved one or something, then sure, like it's completely normal that they're going to be sad for 6 months or however long. But you don't classify that as depression. I think you might find some mixed opinions even between psychologists because it is very much a kind of individual thing. But I would very much classify as depression because you go through the checklist and I can't remember the depression criteria off the top of my head. But depressed mood, tick. Loss of appetite, tick. Hypersomnia or insomnia, tick. Do you match 5 of these 7 symptoms for more than 2 weeks? Of course you do, because you're fucking depressed because your husband just died. Like I think depression, really the big difference between it is that you're not just sad, but you're so sad that it's disrupting your life on a social, clinical, and personal level. And that's why we call it depression, because it significantly impacts your life on a clinical level, right? And so of course if your husband or your girlfriend breaks up with you and it's fucking horrible and you're like so sad that you can't even cope, then I would call it depression. I say that maybe because like I've gone through similar things where I've been like so sad and I've met all the criteria for it where I just knew I was depressed. And it goes away because you process it emotionally. But I don't think it diminishes like your emotion, and I would classify it as depression in that kind of scenario.
Interesting answer. The only thing I wanted to say to that is with mental health problems, with there not necessarily being a physiological aspect, but sometimes there is, but not necessarily. I think that there isn't any reason for something not to be true, if you know what I mean. Like if someone says they're depressed, if someone says they feel this way and the checkboxes fit the definition, then I think it's true. And even if it's not like true, because they feel that way and because it's a thing, I think it still remains like that they are, right?
So
Same thing with
So I think it comes down to perception. If you think you have I think it's maybe more so the case with anxiety than maybe depression. But something you see a lot is people say they have generalized anxiety, right? Or maybe even social anxiety. But the thing is that I believe a lot of people misinterpret just having anxiety to mean that they have an anxiety disorder. And that is not the case. Everybody feels anxiety, but it's this more subtle nuance of a feeling that we don't quite understand. So if you feel anxious every now and then because maybe you have a presentation or because maybe you're a bit nervous about meeting a girlfriend or you have a deadline or something, then it's completely normal to feel anxious. But because a lot of people associate that feeling with negativity, they assume they have an anxiety disorder. And sure, they might go to the psychiatrist and get the anxiety medication, but you have to remember that psychologists and even doctors and whatnot in the US, which is where it happens a lot, I would say, are really lax and they don't give a fuck. So that's kind of my take on it. I mean, if you look at rates of medication given for ADHD in the United States compared to something like France, then it's fucking ridiculous. In France, I don't know the numbers off the top of my head, but to give you an idea, it's something like maybe less than 2% in France, and you go to the US and it's over 50% of the population. That is not the numbers. Do not quote me on it. But the difference is fucking ridiculous. And it's because maybe it's a cultural thing, but doctors on a whole are really just more carefree and maybe they just don't give a fuck. Because there's no way that many more people have ADHD in America. It's just not the case. They don't.
Have you ever heard the term self-fulfilling prophecy? Right.
Yeah.
It kind of brings really true what you're saying. Like if you keep telling to a kid, again, I don't know how that much affects kids, but
you have ADHD.
You keep telling to the kid you have ADHD, you have ADHD. At the end, it's maybe I don't
You
know.
gave your kid
Maybe it's
ADHD.
gonna believe it.
It's like
Yeah.
it's like reverse treatment where your treatment of them actually causes the disorder.
Yeah, and in things like when you're discussing with something and you pass out and you explore ideas and stuff,
Yeah.
if you keep bringing that up, or if I think the worst the people that causes the most problems with that specific are the parents, right? Because a psychologist is probably like a professional, so he knows how to handle that better than parents. But the parents like, oh yeah, Billy has ADHD. Yeah, Billy had ADHD. At the end, the kid is gonna believe that, right?
Yeah, true.
And then
I'll
if
be
there's
right back, my
one
man.
dumb fuck doctor who says, hey, your kid has ADHD, and the parents go, I knew it. And then the kid has ADHD, although it's just really active.
Another thing is it's quite cultural in America. Now, I can't speak for Americans. I'm not an American myself, but I do know people in America, and there is actually like ads on their TV that's like, ask your doctor to prescribe this medication and so on. So there's actually like a big
Yeah.
cultural thing about getting specific medications for stuff. It's weird to me.
Yeah. It is odd, to say the least, that there are so many medications. Like they had medications about like prostate enlargement. I'm like, okay, all right, okay, that kind of whatever.
Yeah, and it even goes so deep, like, here in Ireland at least, we have like loads of different headache medications, right? But which one you take, it's kind of understood that they're basically the same thing, right? You've got
Always
your
Panadol.
basic paracetamol, and then whatever brand of paracetamol you get doesn't really matter. Like they're basically the same thing, right?
Yeah.
Um,
I mean, yeah,
there's more
no,
expensive
and
ones,
yes.
cheaper ones. There is going to be some differences, but it's not like buying one over the other is always going to be better. But like in America, you've got people that are like, no, I only buy this brand because they give the best type of. It's like, what the fuck?
Well,
Yeah,
America's
just
all
brand
about the top
loyalty.
dollar with, pharmacies and stuff. It's all about money.
Which is fair.
Yep.
I mean, they want to give everyone and their fucking mom, what's the ADHD medication called again? Like,
Ritalin?
Ritalin, yeah. Everyone needs their fucking Ritalin, dude. Like, oh, I just can't concentrate without it. Maybe because you're fucking addicted. I don't know. It's fucking weird, but I don't know, like, it's just, I think there's a lot of cultural differences, but that's how it is.
Yeah, definitely.
But I kind of want to talk about sleep a bit as well, though, because you know what, especially while we're doing this like non-gaming episode, it's an area which I'm not only very fascinated in, or Xanax as well, yeah. But it's not only an episode that I'm like, it's only a topic that I'm very interested in, but I think it's super cool because nobody knows how fucking important it is. It's so crazy. Like, you hear people saying these days that oh, I only need 5 hours of sleep and I'm good. It's like, that is just factually incorrect no matter who you are.
I've said it.
Yeah, you've said it. I've read this book like back and forth like 15 times, Why We Sleep by Matthew Walker. And it's just crazy, like, especially because we live in a society these days where sleep is really undervalued, and you start a new job maybe as a lawyer.
But discredited Joker line there. We live in a society. Go on. I have a bet with a friend that every time this comes up, I need to point it out. Just go on. Sorry.
Okay, fair
Continue.
enough. All good. But yeah, but like say you start a new job and you're a lawyer, it doesn't matter what it is, like you're working in business, then you're very much actively encouraged to, be at the office all day and to stay longer and to come in early. And, sleep schedules get fucked. And then on top of that, you've got the 9 to 5, even though people have these very genetically different internal clocks, which is called the circadian rhythm. And it's crazy. Like going back to the example of people saying they only need 5 hours, maybe you're watching and you think, oh, I only sleep 5 hours and I feel fine. And like, sure, subjectively you might feel fine, but like in actual fact, what's happening is that your body has just gotten used to a state of lower cognitive functioning, and so that has become the new norm for you. So when you say it's normal, then it's you're normal, but it's not the best for like what you can do because you're just not getting enough sleep. You need minimum 7 hours to function properly.
Here's the thing, though, right? My life is a portrayal of like sleep nights of 4 hours. That's it. I don't get any more. And because the work is like that, I ended up like even in the weekends, I don't sleep more than 5 hours. Right now, that would be like a good day of sleep to me because I just got used to it. It's so hard to reset your circadian rhythm in a way that it actually goes on with what you're doing in life, right? If you're a businessman or a guy that has to work crunch hour, or the game developer, which I mean, it is a game show afterward, right? And you have to work. It's not gonna work for you. Like the sleep schedule of like 8 hours of sleep, it's a luxury these days.
Yeah, I mean,
I mean, for many
especially
people.
especially for doctors, and there's an example in this book. But there was, I don't know if it's the case in Cyprus, but it used to be the case that doctors could have shifts of longer than 24 hours. Um, and they actually reverted that. They made it a law where you could not be on one shift for longer than 24 hours because the lack of sleep actually increased the amount of errors you made by. I really wish I had I had it highlighted somewhere in the book. I want to say
Threefold at least.
I want to say it.
Threefold at least.
I want to say it increased the amount of errors by like 150%
Oh,
or something.
Oh, way more than that. Way more than that.
Oh no,
150%,
300%.
that would be like
300%. I think it was something like
yeah,
300%.
threefold. Yeah,
Threefold, something like that. It increased
Yeah.
the amount of errors ridiculously. So many other things like
But what are you gonna do, man? Like, okay, for example, right? I'll give you an example of like how it ends up. I have had, Pinky knows, I've had 52-hour shifts. Okay. Obviously, it's not all the time, right? And I do believe you can sleep for 4 hours and be okay. But the question for me is how long you can do that reliably. Because at some point, I'm going to go down to sleep and wake 48 hours later. So I somehow my body accumulates, not really, but it feels that I need that sleep and I could just go into the sleep death type of thing. But okay, I was going out of the hospital when two two ambulances parked and there was a multi-car accident. So
shit.
at that point, I know that a younger trainee is it's supposed to take care of them. So what am I gonna do? I'm just gonna go home. I cannot, in good conscience, just go to bed. So at that point, what are you gonna do? You're just gonna say, "Oh yeah, I can't work." So you're gonna go back to work, and then because there were complications, you end up staying for. I've heard of colleagues like 4 days being in the 4 days in the hospital because of shit like that happened.
Technically, like you're probably not gonna like the answer, but technically, you shouldn't stay.
You should, yeah, but again,
I agree with you that you should.
like I
But
agree.
technically, you
shouldn't
shouldn't.
stay. But
I think it comes down to is a trainee handling that better or worse than you making a mistake with that patient.
always worse. You cannot. You're gonna destroy. Listen, okay. Cold facts, right? Like really scary shit. Logic. Here's the thing. I am finished. I have trust in my abilities, and I am pretty sure that even if I fuck this one up, I'm gonna recover mentally or socially because I think I'm a good surgeon. If a trainee has that, you wasted a guy forever. That means that this person is going to keep repeating the same mistakes or even stop. That means you have one less person to deal with shit later on the line. So you better take the hit and save a colleague for later on. It's warped, but if you try and look at the greater scale of things, two surgeons are better than one in any case, right? This yeah. So that's why you go back. It's not only it's not only the hero complex that you hear everyone says, but it's like I need to protect this guy, this kid, this trainee, this nurse, whatever.
The only ethical implication in that scenario is if you made a mistake because you were sleep deprived and that's the reason that someone died. And like maybe the person, like the person's family who died doesn't know that, or maybe you're morally obliged to tell them like, look, the doctor was awake for 50 hours and you made a mistake and sorry, but your husband passed away. That's like the only kind of implication. But I do agree with you in the sense that two doctors is better than one, and like also for the sake of your colleague, but it is also like it's just something more so that people don't even understand like how much of an impact it has.
Yeah. So I have a few stories about lacking sleep.
Mhm.
A lot. So the longest time I've spent awake is around, I
Oh
can't say for
yeah,
sure exactly, but around 127 hours or just over 5 days.
Jesus.
fucking
Uh,
degenerate.
a total degenerate. And it wasn't even for a good cause. I wasn't saving lives. I was wasting mine. I was playing Final Fantasy X. I was like, listen,
It's like-
You probably lost a few days on your life. Not gonna...
uh, probably. I was like, I'm going to play through this entire game in one sitting with all secrets and everything complete. Now, we know this is possible because speedrunners do it in under 20 hours. They do it in under a day. I was a kid. I didn't do it in under a day. Um, so I did it in 100. I didn't even finish it. I did 127 hours, and then I basically just completely passed out, and I was gone.
How long were
Uh,
you asleep for?
I don't
Oh, 5 hours
remember
later, and
entirely.
I was good to go.
Fuck no, dude. It was like 48 hours or something. It was like
Did you
really long.
actually sleep for 48 hours?
I don't know. I
How
think
old
it
were
was
you?
it was um 13.
What the fuck were your parents doing?
Dude, I don't want to talk about my
Okay.
parents on stream, man.
Yeah.
Jesus
It would not be a
Christ.
good thing. But basically, the only thing that happened for with my parents on in that time was that I was basically like told, "Are you still playing? What's going on? I want to use the TV." I'm like, "Go ahead, play it."
God damn.
Pretty bad.
Yeah, that
Uh,
is not good for you.
man, I was hallucinating
Mm-hmm.
and stuff. It
You
was
listen to it.
crazy. Like after like 3 days, I thought I was in the game, man. I was in the game.
That's some hard drugs right there.
It was crazy. And then the other story, which has a little bit more of a somber tone to it, because I thought there was, that there was something actually wrong with me. Minas, you were involved in this a little bit. Was I don't know if it's to do with lack of sleep or not, but I had an episode of paraphasia,
Oh.
which means
Yeah.
I lost the ability to speak for like speak clearly. I couldn't. It wasn't like I couldn't say anything. It was like I messed up words and became jumbled.
More than you often do. Yes.
Yeah, I'm pretty good at speaking. I can speak quite
Yes.
clearly. I pride myself on that. But when I was there, it was just like the start of the next word would be attached to the word that I'm speaking now, and the end of the word, they would be like mixed,
Yeah, yeah.
jumbled. It was really weird, and I was
So
really scared.
I remember you were telling me about that. I was saying that it could be a problem in I know there's Brocker's area and Wernicke's area, and I want to say speech production is in Brocker's
Brock.
area.
Yeah.
Yeah, so I told you to I literally told Pink like get a fucking MRI.
Yeah, I didn't get a full MRI. I got a scan,
You got a
and
CT scan.
CT scan. I got a what is it? ECG. I got like heart tests and shit. Like they did like other stuff as well.
The,
I
the
forgot
reason I
the
told you to
blood
get the
test.
ECG and the echo, it was because of the PFO that I was scared about a mini
Yeah.
stroke. Yeah, you remember the discussion?
I
Oh,
do
okay.
remember that. Yeah.
Yeah.
So basically, they did like loads of tests. I was in the hospital for I forgot how long, like 6-7 hours or something. And I was talked to by like loads of different doctors and stuff. At the end of it all, everything came back clean. All my scans were fine, and they basically said could it be stress, probably, or maybe caffeine addiction or something. But after hearing about all the sleep stuff, I'm thinking my fucked up sleep schedule could be part of the reason why.
I honestly have no idea if
Yep.
poor sleep could lead to like dysfunctional speech production. I have no idea. I think if it was the case of sleep, then it would have to be severely dysfunctional and more so than what your sleep pattern is like. You wouldn't just get that from like sleeping 4 hours a night. I don't think. But I could be wrong because I really don't know.
Yeah, no one knew. That's the weird thing, right? Because like no doctor had an answer as to what it actually is. Like Minas had a few things what it could be. It's not his specialty, and he didn't want to offer like an actual thing. He's always saying like actually go get tested and stuff, which fair
Yeah,
enough.
I mean,
Should have done an MRI.
telemedicine is not a real thing at the moment, so
Exactly. And then any doctor, like my GP, had no idea. The GP was just
Of course
like,
the
yeah, I'm
GP had
gonna
no
give you
idea.
the.
It's a
what
GP.
else is new about the GPs, man? Just fucking GPs, come on. It's just like don't even.
Yeah.
I don't
And
think
even
a
in
GP has
hospital,
ever
though, like,
fucking known what has been the case. Like, you finished Pink, but I've got 2 GP stories to add onto this.
sure, I'm almost finished.
If we're gonna start piling on GPs, we're never gonna finish.
I've got 2 quick stories.
Yeah, no,
Damn.
I'm just saying, like it's a very common problem in all the healthcare systems. Like the GPs are pretty much shit.
Yeah, I mean,
Damn.
I've had like one problem for years, which I still have now, and it's really fucking annoying. But pretty much like a few years back when I was like in uni, I had like a really runny nose, and you could only breathe through one side at a time. And it was really annoying because I was going, and it was hard to breathe through my nose.
Stop doing coke. Yeah.
Yeah, okay, good one. I've never done coke in my life. Well, except for this. But anyway, and
Do you do lines with that?
oh
Interesting.
yeah, okay. Anyway, I was just like in the mindset of, oh yeah, it will go away. And about a year later, I thought it'd be good to see a GP because it was really fucking annoying. And he gave me
1 year.
yeah,
Wow. Okay.
just guy mentality, I guess. Like, oh, it will get better. And
Yeah.
and then he gave me this steroid nose spray, and it went away. But
Decongestion.
yeah, the congestion. But I still have a problem where like my nose is I think it's my right nostril is still very not congested, but it's inflamed, and so I can't breathe through my nose properly, and like that's why I breathe quite loudly through my nose, and it definitely for a fact fucks up my sleep because breathing through your mouth while you sleep is not great, and it can lead to things like I should know the name of it. Sleep apnea, exactly what I was going to say.
Yeah.
So I'm honestly somewhat convinced I have sleep apnea because my sleep quality is very bad, but that's on a whole another note. So yeah, I went to
you basically acquired or had any chronic rhinitis. That's what you have right now. From the things that you
I
described.
have chronic rhinitis. Yeah,
Yeah.
and I've seen GPs like on and off about it every time. And then they always give me a different fucking nose spray, and then I say, oh, can I get rid of it? Is there a surgery? Is there anything? And they go, no, just take the nose spray and it should go away. And then I say, I've taken 5 different nose sprays and it doesn't fucking go away. Is there anything else? And then she just goes, no. And I said, do you know why I have it? And she goes, no, it could be anything. What fucking use are you? Like, I may as well just go to the pharmacy and be like, hey, can you cut off my nose? Like,
well, there
that
is
would
a
work.
surgery. There is a surgery though, and both for the hunk of a man and both for you, there is a surgery. You can cauterize the. There is a surgery. Of course, there is a surgery.
fucking surgerize me, dude.
I mean, yeah.
I didn't break my nose like hunk of a man
Yeah,
did
but
in my child,
it's
but
basically
the same thing.
Like
I thought for a
what-
while it might have been a polyp.
septum problem.
A septum, yeah. I thought it might have been a deviated septum, but when I asked my
Yeah.
GP, she said it probably wasn't a deviated septum just because it was inflamed.
Yeah, wait. How can you see a deviated septum if it's inflamed?
Tell that to the GP. I don't think GPs know what the fuck they're talking about at all.
Yeah, that's what I'm saying. It's like saying, "Oh, your skin should be okay under this inflammation." It's like, I mean, there's the inflammation there. How do you know the skin is okay? I mean, if it's deviated or not.
Should I just
and
go
it's
to a nose
inflamed.
specialist?
Hmm?
Should I just go
Yeah,
to
I
like
would,
a nose
I would, I would
specialist?
go to an ENT. No questions asked. Like at the very worst, you can have them cauterize some of the
Does
the,
that hurt?
of the mucous membranes there. Yeah, definitely. What
It
are you talking
hurts? Does it hurt or
Yeah.
no?
about? It's not pleasant.
If
It's
I
it
can
depends on
breathe.
your or tolerance to pain, but it's not like like the hang of a man. Probably it's gonna have to have a rhinoplasty, right? If
Okay.
I understood correctly the cases. But yeah, you should talk to them.
Okay, I might do that.
Like a referral doesn't cost them anything. Just
Yeah,
fucking
yeah.
like because this is the problem with GP. They deal with so many. I'm pretty sure there's many people coming into their practice and going, "Hey, I have a runny nose," and they go, "Yeah, okay, take that decongestant," and usually it's to reduce the inflammation with cortisone, whatever, and they
Yeah,
forget
yeah.
to tell you, yeah, well, you should stop after 1 week because then you're gonna reverse it. It's like, oh, good job. Now you have chronic rhinitis. Well done.
I think that's what happened. Yeah.
Yeah, probably.
Fuck, yeah, he just didn't tell me. He
likely.
just said take this like twice a
No,
day for a
they
month.
don't.
Or 2 months. Yeah, I think it was 2 months he told me to take it.
2 months. Jesus fucking. Okay, cool. Okay, whatever. I mean, dude, I'm not.
Did my GP give me chronic rhinitis?
Hey, Minas is not a GP. Don't listen to him.
Yeah, but anyway, and then like I think my second
I'm not
story
a
is
doctor. Technically, I'm a surgeon, so that's so exactly.
yeah. I
Hey,
think
you
my
have a
second
PhD,
story is
okay.
even funnier, man, though, because I was really scared. Cause this is like a bit over a year ago, and it was this time in my life that was very stressful because of situations I'm not going to talk about on YouTube. Not that it's anything I can't say, but I just don't want to because it's a long story. But anyway, I started getting these like not bruises, but like these green kind of patches that looked like bruises on my arms and like on my chest and on my other arm, like, and they were like kind of big, some small, but like it just looked really weird and I was worried. And I had it for like 2 weeks and then it went away. And then like maybe a week later or something, it came back and I thought, okay, well this is fucked. So I'm gonna go see the GP. I go to the GP, they take my blood, they check my kidney, they check my liver, they check fucking everything, and
Yeah.
it's all good. You know, I'm healthy. And then she goes, okay, you're good. I said, well no, I've got this green shit on me, and it might come back. And I said, what is it? She said, I don't know. It could be anything. Could be a skin problem. It could be stress. It could be this, but I can't tell you. I just thought, all right,
Refer me, please.
yeah. And
Don't
you know,
refer me.
one, she didn't refer me. Two, the funniest part is that I had to go to the GP twice. So the first time I said, yeah, okay, I have this skin problem or something. It looks like I have these green bruises on my body, and so the GP said to me, okay, we need to get you in like on Monday for a blood test. So what I'll do is I'll book you in from, because normally you have to wait like a few weeks for an appointment because the NHS is shit. And so she said, what we'll do is we'll get you in 3 days later because in cases where it could be cancer, then you're allowed to be sped up. So she pretty much told me like, yeah, you could have cancer. And then during those 3 days, I was shitting myself. I was just like,
Oh.
holy fuck, like, please, dude, no. And then I came back 3 days later and she's just like, yeah, you're good and I don't know what the fuck it is. And it went away and never came back. And my assumption is that it was because I was very fucking stressed because of shit going on in my life. Fucking women. But, I don't know.
I'm into that, bro. Fucking women. That's a wise thing to say, actually.
Yeah, Shrek transformation. Actually true. Mid-B Shrek.
Dude.
Go to, I mean, I
at
never
least-
came back, Doji, so I never went to a skin specialist, but it was weird.
At least you can start singing like Smash Mouth and not feel cringe about it.
True. Although
Hey,
you couldn't really see
somebody
it because...
once told me.
Somebody
Just
once
told me. And we're gonna get demonetized here.
Fucking
Just-
hell.
we live in a society.
Discounted Joker meme. Let's go.
Yeah.
Sorry.
But actually,
no,
no,
yeah.
sorry, you finished, Minas. You can...
No, I was just saying like the GPs are like good GP. I have a couple of like mentors that are GPs. That they are the most amazing doctors I know, right? But they're not. Their specialty is not GP. They're inner medicine. Their specialty. So
I
they're
feel like-
6 years instead of 4 years.
Yeah.
Right. That these 2 years make a huge difference, and they would. I always love to go to their praxis. How do you call praxis?
Yeah,
in-
practice.
Praxis. You say praxis, okay?
Yeah.
And to see them work, because just by see how people are walking or how they're sitting or how they're behaving, they can understand what's probably the cause of their illness.
Yeah,
or
right, and
What,
that's-
what they're having.
Yeah.
This is
No,
so like, they're amazing people. That they would put the diagnosis even before you start talking. And then again, there are people who give to a 26-year-old with higher blood pressure diuretics, which normally you don't unless you have a heart failure problem. And I'm sorry, I'm getting triggered by myself, but it's there are so gross problems that happen, and you're thinking, where did you get your license, mate?
Mhm.
How did you get your license, or do you even care? Because I'm pretty sure all the doctors have a minimum standard that it's sufficient to treat a normal problem, but most of them stop caring, and that's where it causes an issue. Like, okay, there is an illness, or your example, green spots on the screen on the skin, which I don't know what the fuck they were either. Man. Like I have nothing that
Yeah.
drops in and say, oh, that could be. But there's a very simple solution: refer it further.
Mm-hmm. Yeah,
Like,
I
there's-
didn't get
Like,
referred
there's
at all.
no reason not to.
In fact, when I actually, fun fact, And just with what you said before, I have like 2 really good points I can like continue with about that. But just fun fact with my green spot story, I specifically asked, it's actually not the green spot story, but my nose story. I specifically asked my GP to refer me to a nose specialist. I said, please, I've had this problem for like 5 years and I just want to be referred to a nose specialist. And she didn't, I don't know why, but she didn't refer me to a nose specialist and just said, take the nose drops for a month and then come back to me. And I said, I want to see a nose specialist, and she didn't refer me. It's a fucking joke, man. Like, you don't know what you're talking about. You give me the same shit that every other GP is giving me. You think it's gonna work? Like, it's really stupid.
I mean, to quote the guy from Far Cry 4 or 3, like, what's the definition of craziness?
What's the definition
repeating
of
the same
doing
thing
the same
over
thing,
again and expecting different results.
Exactly.
Yeah.
That's Einstein as well said that, right? I can't remember.
No.
No, is that a fake thing?
That's fake internet meme.
God damn it. But yeah, so actually,
that's why I stayed with the Far Cry thing, because I know that I played the game and that's where it said that.
But
I
actually,
don't know who said that though.
I have 2 good points about what you said before. Is you said that the GPs, really well, and that are mentors, they start diagnosing like before you even start talking. I think that's a really good point because one, I think like GPs that have specialized in something and have those 2 years extra knowledge, obviously gonna be way better. And one, because they're gonna have just as much knowledge about general medicine as a GP. But like it's like if you go to a psychologist, between someone who is a psychologist who has just done their undergraduate degree or someone that's done their master's degree and become qualified, like the difference in 2 years is fucking stupid. But then on top of that, like I think a really important distinction is you've got the 4-year GPs and they know fucking nothing. And I find a lot of the time what they do, and it's especially the case in France. Like I saw this GP in France about the exact same thing. I was in there for 30 seconds. He says, yeah, you have an allergy. Take this medication, this, and this, and then he sent me off. He can get fucked. But what I find like really crazy there is the distinction between GPs and practitioners in general that abide to the biomedical rule of practice as opposed to the biopsychosocial model. And, so like the biomedical being like kind of old traditional doctors saying like, okay, you have these symptoms and these symptoms, so I'm going to categorize you into this little box and just send you on your way. As opposed to the biopsychosocial model, which goes, okay, let's take a look at like your biology and, what's happening. Let's take a look at your psychology, seeing how you behave and stuff. And let's take a look at your social characteristics and factors. And then we put it all together. And so it becomes a case of, instead of diagnosing people based on their symptoms, you diagnose them based on just being a person. And I think that really like follows into what you said, because you have the shit GPs where you come in with a nose problem and they go, yeah, you have an allergy. But then they don't actually listen to you when you tell them that it's not the case, because they think because they're the doctor they know better and they're going to put you in that box, right? But when you have doctors,
the patriarchal, it's the old
exactly, it's the
hierarchy,
old model,
right? It's like the doctor is the god and everything falls behind that. Yeah,
exactly, it's the biomedical model. And then I guess Freud came along and changed it a bit, and credit due what credit is due, even though the guy was kind of loony. But yeah, then you have the biopsychosocial model, and it's much more about the person, and you diagnose the person instead of the symptoms. And oftentimes you find that you get a much more individualized kind of care plan, which is like not only better for the patient, which is crazy, but it's better for the doctor as well because they make less mistakes. I went to a hearing specialist, did some tests, but they didn't find anything, so they blamed it on my shitty nose. Might not even be connected. Damn. But another thing I wanted, so that was one point, but sorry, I'm very thirsty. But another point I wanted to link that to, just in general with GPs knowing fucking nothing, is GPs, and like this book talks about it, the GPs, for the most part, don't know anything about sleep and don't value it at all. And it talks about it a bit in this book, and it's not like shitting on GPs like I like to do. But I'm not even
like to shit on the GPs.
True. I'm not even kidding though, but GPs could literally prescribe people sleep and I'll be fine. Like I'm not even joking. I can't remember where it talks about it in the book. But someone comes in with fucking headaches and or maybe they're a bit sad, or maybe they're always hungry. Who fucking knows, right? It could be anything. But say someone comes in with this problem, the GP will have a first instinct or response and just go, here, take some SSRIs, here, take this medication, yeah, take this nose spray. I don't fucking know. Literally, prescribe them sleep and it will maybe go away. I'm not saying like, oh yeah, sleep cures cancer. It doesn't. I'll be honest. But
But no, at that point, it has been the research. I don't have I didn't come prepared like you guys, but there have been researchers that have showed that better sleep cycles result in less occurrence of cancer, occurrence of cancer.
But
So incidents,
actually
there
might
you
be
go,
true.
found the word.
incidents.
oh,
Good one.
incidents. Yeah, actually, I think you might be right. I think the book even talks about it. Maybe. I think it
Again,
does.
I don't have
No,
the
you're
quote,
right.
but I've read it and I was like, fuck, I'm
Honestly,
gonna get
sleep is
cancer.
magic. But like before you, like, sorry, Ping, I think you want to say something, but I guess I can show the graph, but my camera is pretty shit. But pretty much, I think it's this picture, just to like show you guys just how crazy sleep is. So there was this study essentially giving spiders different drugs, and so like it's obviously spiders make webs, and how well they make the webs is a function of like their brain and their physiology and stuff. And so what researchers did was they went, okay, well, what happens if we give spiders different kinds of drugs, and then let's see how it impacts their web making. So what they did is, I don't know if you can fucking see, it's not going to show too well, I don't think, but you can see the webs here. So the big square web there is just normal, right? Then you've got this one here. This is what happens when you give them LSD. So you can see the web is very concentrated in the middle, but then the outer web is very poorly made. Then here you've got marijuana. So you can see the web is like pretty severely impacted, but it still kind of works. It's about as bad as LSD, and obviously much worse than normal. Then here on the top right, you've got speed. The web is like pretty deformed, but it still works. What's crazy is that we live in a society, please don't make the joke, but we live in a world, rather, where caffeine is just consumed by every member of, society or anyone with a fucking 9-to-5 job. And this is the spider's web when it had caffeine. Right here. The web is non-fucking existent. I don't know if you can see that too well, but the web is just fucked, right?
You live in a society.
Caffeine is a stimulant drug, and like I'm not sure on like all the research in this area, but it inhibits your capacity to like fucking English. It inhibits your capacity to execute functions properly to a certain extent. And the reason it's extra bad is because if you're relying on caffeine, even if you're having one at 4 a.m., then the effects of that caffeine is still going to be in your blood by midnight. And it lowers your sleep quality.
What was it? I think it takes about 3 to 4 hours to start working, and it has a life cycle, like half-life cycle of 24 hours or something.
There's a half-life like 12 hours,
12 or
8 to
16
12
hours.
hours or something. I can't remember.
I don't know. It's like it's absurdly long. Like there are medications who were supposed to have a long duration, don't have that much duration. And I'm when I read it first time, I'm like, Jesus Christ! And when I tried to titrate myself off from caffeine because I don't want to immediately stop it, because then, woof, it was hard. Even just by reducing 1 cup of coffee, for me, I could already seeing me being more aggressive, less patient, like doing mistakes, like confusing words. And it's at that point where I said, you know what, I just need to pull the Band-Aid out, and I stopped caffeine, and that was one of the best ideas I ever had.
Yeah, I haven't had coffee in a while. I am a bit of a hypocrite because I'm drinking a Coca-Cola which has caffeine in it. It's like 10 p.m. or some shit.
Enough.
11:40 rather. I mean, I can still fall asleep even if I have 10 cups of coffee, but it's obviously going to negatively affect my sleep, which I understand. But
it makes a very shallow delta waves, I think.
You see that with EEG and stuff. Obviously, the sleep waves are very important. I think it compromises your deep sleep. I could be wrong.
It's like alcohol. It doesn't allow you. Caffeine allows you to go into deep sleep. Alcohol doesn't allow you to go into deep sleep.
So
that's why you wake up so fast after an alcohol drink.
So not necessarily. It's actually not deep sleep. Alcohol doesn't allow you to go into REM sleep, which is technically.
I thought that. Okay, my mistake.
Yeah, no, it's confused because technically REM sleep is like your deepest stage of sleep, but it's actually the brain waves you see with REM sleep closely resemble that of being awake. That's why you have rapid eye movement.
Yeah.
Your brain is very fucking active during REM sleep. But
Okay.
deep sleep is just where you have very slow, like delta brainwaves and stuff.
All right. Okay then. Yeah,
Which
then,
and they have different functions. But yeah, pretty much what alcohol does is it doesn't allow you to get REM sleep, which is where you dream and stuff, and it also does a million other important things like learning and emotional I want to say recalibration, but emotional processing, and just a ton of other things like that. REM sleep is super important, and that's why you have like for example, like younger people and especially kids have way more REM sleep than adults, just because there's a lot of learning and stuff going on.
yeah.
But I kind of like, I'm super interested in sleep, but before we talk about some other things, I kind of want to relate it to my dissertation, because I'm starting that tomorrow, or I'm continuing it tomorrow. And so pretty much what my question is, and I'll probably be changing it slightly just to make this the research process a bit easier, so I can incorporate a few more aspects. But I think what my question was before, for my pilot study, and it's going to be like the main scope of what I'm looking at now, is assessing. What was it? Assessing the effects of poor sleep on outcomes in people with schizophrenia. And so, like, the reason I think that's a really interesting topic is because you've got schizophrenia, which is already one of the most debilitating, if not the most debilitating mental disorder. And a really common symptom of schizophrenia is dysfunctional sleep. But not only is it associated with the disorder itself, but it's actually also a product of the medication that people take with schizophrenia in the form of antipsychotics, because they normally target histamine receptors, which pretty much makes them sedatives. So, for example, I'm talking to this guy at the moment weekly who has schizophrenia, and he takes clozapine. And he says within maybe 30 minutes, it just knocks him the fuck out. So he has to take it at night, because otherwise it completely disrupts his circadian rhythm. And I think it's a really crazy area, because I'm taking a really broad look at the kind of implications of dysfunctional sleep on people with schizophrenia. And not only do people who have schizophrenia and dysfunctional sleep have high suicide rates, more depression, more obesity, lower quality of life, and shit like less social support. But it's just fucking insane, because it seems so obvious when you've actually taken the time to really study sleep and look at other articles. There's so much crazy shit that a 10-hour podcast wouldn't even be able to cover. I mean,
Of course, yeah.
I remember I was talking to Pink, maybe this week or something, about this study which found that the amount of sleeping pills you take is directly proportional to early mortality in cancer. And so if you take even less than 24 sleeping pills a week, then your chance of dying is, I want to say, again, I'm kind of spitballing the numbers, but your chance of dying is maybe 25% higher within the next few years, even if you take less than 24 a year. And if you're taking more than 100 a year, then your chances of dying is threefold. And obviously they're controlling for other factors heart problems, age, weight, sex, smoking, alcohol, and all sorts of other shit. But
You'll be happy to hear I've never taken a sleeping pill.
That's good. I have, but
no. When I yeah, I'm not gonna comment.
Actually, I want to relate some of this back to something, okay? And this isn't exactly related because you moved past it a little bit, but when you said GPs could just prescribe sleep, and they'd probably do better. I don't know if that was your intention to say that they'd probably do better or not, but that actually goes back to something science related that I found a while ago, which is homeopathy and these kind of pseudoscientific medical beliefs, right? So crystal healing, homeopathy, what is it, the distillation treatments for cancer and all this kind of thing, which is insanely, in my opinion, crazy. You should never do those things because they don't do anything, and you should talk to a professional, right? But the reason why they became popular or positive in the first place as far as I understand it, is because medicine hadn't advanced far enough at the time to actually provide answers, to actually know what's going on. And people weren't as careful maybe in the 1600s, 1800s, right? And so when these things appeared, homeopathy, for example, is the big one, that did essentially nothing at all. It was still better than doing something, because the something people did back then was actually harmful, right? Like
Yeah.
the bleeding and stuff.
Okay.
I could say something too, but
Can I
Minas,
talk
you
about
could-
homeopathy because I have a lot of things to pick with them.
Yeah, sure.
So the reason that homeopathy came up to prominence and acceptance, right? It was due a pandemic. I don't remember which one of them was, right? Where medicine was actually it was putting all the people in one place. I think it was typhoid.
It was placebo.
Typhus, right? Yeah.
Sisang?
And the treatment of choice back then was to de-blood the patients with
Bleeding, yeah, but that's not homeopathy, right? That's
no. That was the medical way,
sure.
right? And they would have them in these rooms without sterile conditions and everything, right? The person who invented homeopathy had them outside in the clear sky, open doors, single rooms, yeah. And apparently, homeopathy proved to be more effective than
Yeah.
medical practice. So from there on, we started doing the whole weird voodoo shit, which I kid you not include taking a stool made of horse leather and beat it with a whip from horse hair 150 times in order to dilute it appropriately. These are if you're gonna read it, this is what comes up. So that's where the whole homeopathy came to prominence, and now like people with homeopathy. This is just bullshit. Like it's what you said. Medicine didn't have the proper answers, and medicine in the end ended up taking some practices from homeopathy, which are not really like only in homeopathy anymore. Right? This okay. If you consider the aseptic method a homeopathic method, I'm fine with it. But the rest, when I hear about homeopathic drugs, it's hard to not laugh. And I'm not trying to offend anyone, but if you're having a cancer and you take homeopathic drugs, you should. Yeah, no, just don't.
You shouldn't do it.
No, just.
Actually,
Or rather, it doesn't
I'm not
actually
sure I want to
matter.
debate. I want to have these genes in the pool. Just maybe let natural selection. Just sorry,
Well,
edgy.
I actually have a really
Actually, no.
interesting point to homeopathy as well, but Pig, you finish first because I can.
No, but homeopathy actually doesn't do anything. That's the point of homeopathy, right? It's all
Not exactly. It's not like it doesn't do anything. Like for example, for skin condition, eczema and stuff like that, they tell you do not eat coffee, do not eat chocolate, do not eat a lot of sugar. These things work, but these are based on medicine. But the medicine on the medical like research, but the medicine like what they produce and give you, these are BS. Right?
Yeah, no, but what I mean specifically is that homeopathy's foundation is that whole solution things. Like, the thing that causes it is also the cure.
Mithridandism. That's the whole idea, right? The Mithridandis principle, where the king of a certain state was having a bit of poison each day in order to be able to build immunity to the poisons back then. And when he got invaded, he tried to suicide with poison, and he couldn't because he had an immunity. We do that with vaccines, which don't cause autism, right?
They don't.
No, it's crazy.
I can't believe some people don't vaccinate it. That's a whole other fucking topic.
I'm wondering where are they now? Now because they're very quiet in COVID. They're very fucking quiet.
True.
Where are they now?
I'm
trying to find an anti-vax mom, and I haven't. And I've been working in the hospital since day one of the pandemic, and I haven't seen one anti-vax mom. I'm very interesting to see where that mom is.
Yeah, no.
That's cool.
They're fucking brain dead.
So,
but placebo does have a positive impact. We won't argue that, but that's psychosomatic, right? That's separate to whether or not you're physiologically...
Well, psychosomatic is maybe the wrong term.
Well, maybe the wrong term, yeah.
Psychosomatic is having a psychologically induced sensation, like psychologically induced physical sensation, right? So
There you go. Yeah, he said it.
psychologically somatic. Whereas placebo is something else because in some cases, and like honestly, I don't know how. I'm not an expert.
Placebo works, guys.
So I don't know
I
how
just
it
know it
works
does.
too well, but it can work sometimes, right? Like we know that placebo can have like significantly strong effects, and we see it in studies sometimes because we occasionally use placebo to measure if a new medicine or therapy is actually clinically effective. You know, because we see if a therapy or medicine is doing the same as a placebo, then it's fucking shit, right? It doesn't work. But if it does better than the placebo, then we know it might be good. So obviously, Hunk of a Man was saying that like homeopathy, I think he was saying it was a placebo, and then maybe it sometimes works. So in some ways, it was maybe better than nothing, but obviously it's fucking bullshit, right?
Okay. So, sorry if I. Do you want to finish
Yeah.
your?
You say, and then I'll finish my point. It's fine because it's a
Alright,
separate thing.
so I personally I love placebo. I tend to use it quite a lot. Right, when I was second year of specialty, there was a guy who was really addicted. He had chronic pain in the nerves because he had an electrocution in the past, so he had chronic pain. He would get like this crazy medication. We're talking about morphine and pethidine and stuff like that.
Oh shit, yeah.
And he would come like 2-3 times to the emergencies, and you cannot give all the time these like basically cocaine analog cocaine oh my god
Heroin, right?
heroin analogs basically, right? So what I ended up doing at the end was just drawing up a needle full with a syringe full with normal saline, which is just water with some salt,
salty water.
and inject him. And he would go and say, like after a week with this treatment, he went, "Doctor, I'm feeling so much better now, and I haven't given him anything for 3
Probably
days."
felt better because he wasn't
So-
taking fucking morphine every day.
It's amazing that sometimes it works, but it's not going to treat cancer. It's not going
No,
to
of
treat
course.
like the serious stuff. Pain, because it's a perception thing as
Mm-hmm.
well as physical. It has amazing
Of
results,
course,
but
yeah.
not in everything. If it's a
I think-
mechanical issue, it's not going to be fixed.
I'm not 100% sure on like the validity of the studies, but I think I've seen some studies where placebos have had like a somewhat small clinically effect on outcomes in cancer, but I could be wrong. But I think that has to do with a perception of hope, which can improve outcomes. It's the same in I think medicine.
Endorphins do affect positively cancer, right? And if you're happier about something, the endorphins are technically higher as well, so that may be the indirect cause.
That
but
makes
that's
sense,
a fine
yeah.
treatment.
Yeah,
that's a
exactly.
fine. Yeah, like
Yeah.
on look and overview. Usually, again, don't quote me on that. I think I've seen it somewhere. Like patients that I've seen it with my patients, but again, anecdotal evidence for a very small sample. Patients who are really positive when they come for the surgery, and they don't tend to ask too many weird questions, and they're like they seem trusting, and they seem like, yeah, we're gonna get through this. You see this positivity on them. I usually tend to have way less complications with them. But again, anecdotal evidence. Like
Okay.
from what I've seen and what I've heard from colleagues, this is the general belief. That's kind of, pseudoscience-y. It sounds pseudoscience to me, at least when I say it. But again, it's
Okay.
I don't know. But I'm pretty sure it has something to do with placebo and all this. It connects somewhere.
Yeah, but okay. So one last thing because you were talking about homeopathy, and I actually have this in my notes right here. It's really interesting because psychology kind of formed on the same kind of foundation as that kind of stuff. You're talking about how modern medicine has taken over that kind of pseudoscience, and obviously it doesn't work. But psychology has exactly the same foundations. Like you start with things like the Hippocrates model, which goes back all the way to like 300 BC, and you actually had this model for mental health, which revolved around pretty much the four elements, right? So you had fire, air, earth, and water. And what they did was Hippocrates kind of classified these four elements into different things. So if you had too much of the fire element, then that was called yellow bile, or other words, choleric. Or say, air, that was to do with blood, so they called it sanguine. And so, like, what they would do is say, like, you were sanguine, like, it would represent a certain personality characteristic where you were, like, dysfunctional in, and they would either, like, give you blood or take out blood. Or even, like, if you were melancholic, which would be, like, a personality dysfunction, then they would call it like this earth black bile thing, where I think they would inject you with like this black bile, and there's completely no like scientific basis for it, but it was what they did. And then obviously you're going into like these times ahead where you've got a very strong religious emphasis on the devil and religion, right? So you've got these people who may have something like schizophrenia, and then it's being interpreted as the devil has possessed him, or some shit like that. And you've constantly got these morphing philosophies and ideas about illness and also mental illness, and they're changing. But then once you start seeing modern medicine come in and take its place, then you can only then see that it's fucking bullshit. It's the exact same thing with mental health.
Here's the difference. But here's the difference between homeopathy and psychology. Psychology works.
Exactly. but that's the difference,
like,
right?
Legit. I would, like, when I say I would trust someone who is not a doctor to treat me better than someone who studied to be a doctor. That's for me, like, there's no higher praise that I can give to someone, or a section of something, right? It's like they're better than doctors in many cases. Like, first you go to the psychology, and then if the psychology thinks that you will need medications to pull you out of that, then you go to the psychiatrist. It's a secondary, like, that's how I see it. It's a secondary guy to go and talk to.
No, exactly, but the point being, like, even medicine, where you didn't initially have those things that worked, like we have today, then you have these alternative explanations, which is just anything they can kind of scrap together that makes sense to them, because otherwise you're left in a world, right? Where...
Man, I like, when I was 5 years old, 6 years old, I remember, like, my grandma, when she was feeling that she'd had high blood pressure, she would put lichers on her back or use the weird cup suctions.
Yeah. My roommate has to do that.
Okay, so these have been proven that they're not working, like, especially with
I
the
think
leeches.
cupping works, no?
I don't know about cupping, but I'm pretty sure about leeches. It doesn't
Okay,
work.
because cupping is where they take out the bad blood. Because my roommate, he has a slip disc, so the blood around this like one part of the spine or something becomes trapped or something, and so they do cupping to take out the. Is that different?
That's blood mobility. I'm talking about high blood pressures.
Oh, like, yeah, for high blood pressure, it's bullshit. Yeah, right.
Which makes sense. Like, if it's a high blood pressure, let's take out the air out, or the blood out in this case. So and I remember that. But again, it's based on some sense of, there is too much pressure in something, let's take something out. But beating a vial on a stool made out of horse hair and horse leather with 108 strands of it 105 times, that sounds like... No, if I say alchemy, I will be offending alchemy. It sounds retarded. Like, I cannot find, like, okay, too much blood, high pressure, take some blood out. Okay, it could have worked. There is some logic to it. How does that relate to, like, homeopathy? It's a sham when it comes to medications.
Just make the veins bigger. Easy.
Yeah, I mean, come on. What are you thinking, God?
True. That's a topic for another time. Oh, God, I don't know if we're allowed to talk about... No, you're definitely allowed to talk about that on YouTube. But actually, that'd be a great idea for a future podcast. Definitely, we'll get the like and dislike nice and even. 5 to 5.
Homeopathy, yeah. Dude, that's like insane. But can I just talk about, like, while we're on the subject of, like, pseudoscience and, like, homeopathy and things that work and things that don't, let me just shift a little bit into my specialty, just a little bit. And that would be culinary side and nutrition. Because yes, nutrition is a valid science and it's a real science, and there is experts there that are fantastic.
Oh,
but it's filled with...
He believes that.
It's filled with so much bullshit, so much pseudoscience, so much beliefs that are unfalsified and they stand on nothing. They're just like, hey, this is...
You call it culinary science instead of food biology?
We call it gastronomic science, actually, what I'm studying.
It's food biology, no? Sorry,
is
Pink.
nutritional biology,
Surely-
though.
You know, there are
I know
people.
you.
It's okay. There are people that say psychology isn't a science. So yeah, I've seen plenty of memes about that and
I
whatnot.
mean, there are people who say we didn't land on the moon, man. It's just don't take everyone
Hey,
to their word.
why are you mentioning
Bro,
my
I
dad?
know someone
Why
who said
you,
the moon
my
landing's
dad
not
doesn't
real.
think we landed on the moon, dude.
Who?
My dad.
I mean, he's an
Oh
older man. He might have forgotten. That's fine, though.
Dude,
But think about,
dude,
like,
he's
people-
only like 51 or something. He's not even very like.
Dude,
Okay.
My
I'm not
dad,
gonna
my
comment
dad
on
is
your
just
dad,
super
Joey.
into
Come on.
conspiracy theories. By the way, Pink,
Australians.
Pink. No, he's not even Australian. He's fucking German.
oh wow, okay.
German's Dutch, but Pink. Okay, we need to do this for our next, our 10th episode, conspiracy theory special.
Oh, dude, yes.
We
I would
we
watch the
each.
shit out of that one.
You can come Minas if you want for the 10th one. But like
Gotcha.
we'll do some research and we'll find we'll each get like 5 conspiracy theories and talk about them.
Oh yeah.
We can
Oh,
even do
yeah.
like a
Okay.
PowerPoint slide if we want. I don't fucking care. But
You
I've
can get someone else, and I can feed. That's how happy I would like to see you discussing that and just trying.
you know like
Dude,
I
okay.
won't go into it in detail now, and I don't want to cut you off about your food biology stuff, Pink. Sorry, culinary science, but
Gastronomic science.
gastronomic science. But there is actually one crazy conspiracy theory. I'll just like briefly mention it, and it's actually something I heard from my dad. It's not necessarily a conspiracy theory, but it's just really coincidental and very weird. But pretty much, my dad works in, and he told me this when I was like a kid. But even more recently, and pretty much it's about 9/11, and so my dad works in shipbroking, and so you know what that means is he sells like oil rigs and tugboats and other kind of vessels for that kind of stuff. And he was in like before 9/11 he was working kind of closely with this company around his business that he was working with, and pretty much exactly 1 week. Oh no, wait. So he had these deals going on with this company, and suddenly they withdrew all of their members from the building. From like the Twin Towers. They cut off their business like that, which like for a big company like back in the day is just unheard of. Like you don't just withdraw everyone without notice or without like saying it at all, and you don't just like stop what you're doing. But pretty much exactly a week before 9/11 happened, they did that, and then like afterwards, what I'll do is I'll ask my dad exactly for the details, so I'm like prepared for the next podcast. But it's just so fucking crazy, and then like something happened up. This is gonna sound shit on YouTube. I don't care. It's fucking weird though. Like massive big company just suddenly like gets everyone out of the fucking buildings, and then a week later that happens. That's kind of suspicious. But I've heard some fucking crazy conspiracies about like
Dude, I've heard-
9/11 and everything.
Like, I've heard some crazy conspiracy stories that seem legit at first glance, but then when you look even a little bit closer, it's like, yeah, okay, nah.
No, I've
you
got
know?
one which I'm still confused about, and that's
The flat Earth, me too.
no, no, Tupac, dude. Dude, I'm not even kidding. You see, so Tupac died on the night he gave a concert. You see him going to the concert with short hair, and then on the at the concert, he has long hair.
A wig or something, man.
No, like maybe it's the other way around. Like I don't know, but it's just so weird. I'll look into it. I don't want to like. Let's not talk too much about it. I know I started
Yeah, of
this,
course.
but there's
We'll have to look into it.
there's like conspiracy theories where you see them and you're just like, what the fuck? And then obviously you see like you see the info and you're like, oh okay, like landing on the moon. Like that's a dumb one. My dad tried to get me to believe that we'd never land on the moon.
I've met 2 people that don't believe in the moon landing. One of them I know quite close, and the other person was, for
It's not your
example,
friend anymore?
the other person was a guard at the EA building when I used to be customer service there, and that person basically was like, you know, the moon landing never happened, right? I'm like, what the fuck were you telling me this? You're the fucking guard. It was so weird. It was surreal,
That's
man.
gonna be a good episode in 5 weeks' time, eh?
Yeah, it's gonna be great.
I'm keen.
Yeah.
Fuck,
Sounds
why
like
make it
something
every
fun.
5? Make it every 1 podcast. We just don't talk about gaming. Fuck gaming.
No, I'm totally into gaming though. No,
Yeah,
but fucking.
Pink, what were you talking about though with gastronomic food biology?
Yeah, man. We cut you off like ages ago.
Sorry, I cut you off there.
You've been cutting me off all night, bitches.
Sorry, I'll let you talk more.
It's all good. Essentially, like, man, my train of thought. No, basically, it comes down to nutrition being basically a fucking pseudoscience at this point because of how little actual credible research is there. Like, you have people researching it, and there's like legit people, but at the same time, there's so much bullshit and so much anecdotal, like, feely craft, and that is really annoying, and I don't like it. So I'd like to kind of revolutionize it a little bit. But then when you talk to people about it, like for example, weight loss, right? One of the most simple things in terms of nutrition is how weight loss, the mechanics of it, actually
Eat
works
less.
on a grand scale. Like, not obviously not for individuals, right? Because each body's different and so on. That's true. But like on a grand scale, it's amount of calories in versus how many calories your body uses is equal to the weight change. Like, that's just universally true. And people are like, nah, but I eat only very little amount. It's like, yeah, but you still eat too much if you're gaining weight, obviously.
I only have 6,000 a day. Only 6,000 calories. I mean, the way I see it is like okay, I've talked about this with people before, and some, it's a bit of a cynical and somewhat controversial opinion, but I don't care. Hate me if you want. Losing weight is fucking easy. Like if you think about it, it's easy.
If there is no underlying pathology.
Yeah, if there's no, okay, I agree
Okay.
with you. If there's no underlying
All right.
pathology, because obviously then that makes it complicated. Like if you have some specific type of cancer or something.
Thyroid.
Exactly.
Thyroid.
100%
like
agree with you.
Diabetes and stuff. Yeah.
But-
then I
yeah.
agree with you.
But if you just eat too much and like say, and the biggest excuse is I'm addicted to food.
Yeah, but even the underlying conditions like hypothyroidism and diabetes, they will affect how you gain and lose weight for sure. But it's not like someone with hypothyroidism cannot lose weight, right?
Okay,
There is.
Well, it depends if
So
on your ability
hold
to
on,
move.
Joey. Hypothyroidism does cause depression, correct?
It can.
Right. So depression can cause dependency on food and stressful eating.
Well, I'd say
Yeah, sure.
I'd say more than like a dependency on food and stuff. It can cause hyposomnia, which reduces your appetite, and on top of that, it can pretty much reduce your pleasure in activities and stuff. So it makes you not want to exercise. So yeah, there's factors like that, for sure.
So if there is I agree with you guys 100% up to the point where it starts to underlying pathology.
Yeah, no, I agree
And
as well.
obviously, if you have a insulin resistance, obviously it's not an excuse for getting fat. But if you're having like a diabetes, then it's all bets are off at this point. Like
Yeah,
you,
I mean-
you cannot predict. Like if you have even like pathological and psychiatric or psychological issues on top of that, it becomes really hard to lose
Funny
weight.
enough, depression
but
can,
everything
can
else-
cause weight gain.
Yeah, I agree.
But Minas, I'm not talking about whether or not it's possible for you or a single person, because obviously it's going to make it harder, and there's going to be the psychological issues, and there's going to be the pathological underlying problems that's going to shift the equation. I'm talking about in general the standard statement of calories in versus calories out is equal to weight change.
That's why I'm
100%
saying
agree.
it's easy.
And even if there is an underlying pathological issue, right, that equation doesn't become untrue. It just becomes like unreasonable. It becomes skewed and unreasonable to achieve.
I agree. I mean, like, but if you're looking at, so just to finish off with the underlying conditions, like the funny thing is, if you're depressed and that's the reason you're not bothered to exercise and lose weight, it's actually kind of funny because exercise is actually one of the proven things that actually helps get rid of depression. So you're really killing two birds with one stone there. But yeah, obviously, like, if you've got a condition, then that not only makes it easier for you to become overweight, but then sometimes it can just completely like make it impossible for you to lose that weight. So for example, with some cancers, you can't even get out of bed because it hurts too much or you can't move, right? So
Of course.
obviously putting that aside. But like my stance is that if you're just overweight because you eat too much and maybe you like food too much or whatever it is, then it's fucking easy to lose the weight. You eat less calories than I'm fucking confusing myself. You eat less calories than your body uses, right? And then you just lose weight naturally. And all you have to do is stick to a regimented diet and fucking exercise a few times a week. It will happen. Like,
Yeah, but even exercise isn't needed, right? Like people think
No, it's
that
not.
you have to go to the gym or whatever. It's not true.
No,
No.
don't.
Like you can
It helps,
you can
like running
lose
helps.
weight just eating chocolate. nothing else, and drinking energy drinks and Coca-Cola. The only thing is, you have to drastically reduce the intake so much that you're going to have like malnutrition, right? That's going to happen then if you do it that way. But you can do it that way.
I don't
I
recommend
mean,
it though.
there was that experiment with a guy. Obviously, it's not a real experiment. It was just one guy that used to eat McDonald's for 3 months,
Exactly.
and he lost like 10 kilos or something.
Oh,
It's
yeah.
all about
I've done that.
amount.
Yeah, it's literally all about amounts.
Yeah.
That's why like take everything in moderation is the best way to live in terms of food.
So, Pink, I have a question for you. I've heard that the best way to lose weight is by eating for no. Is it for losing weight or putting on muscle? I can't remember. Either way, I think you might know.
Protein.
What's that?
Are you gonna say protein?
No.
Okay.
I've heard that I think it's losing weight, right? But it could be gaining muscle. But I've heard that eating smaller meals more times a day helps you lose weight more because it keeps your digestion going. Is that true?
There is no conclusive evidence for it. I've read a few things that suggest that, yes. Because basically what it does is eating small meals all the time keeps your digestion going, as you say. Keeping your digestion going adds metabolism, so you're losing energy by your metabolism constantly going. But at the same time, there's evidence to show that if you eat a big meal, it takes longer to digest as well, so you're also keeping your digestion going and you're losing energy that way. Plus, if you eat bigger meals, there is more of it not processed. So basically how you actually get calories from food is it gets mulched in your stomach, then it goes through your intestine, and your intestine absorbs nutrients with the villi and so on. But if there's a lot of stuff at once, the center of it might not be fully absorbed, but that you need a lot of it, and it needs to be compacted. So usually that's not.
I've got a great topic about nutrition. Sorry, Minas, what were you gonna say?
No, I was just gonna say about there's the idea of multiple, which is the general consensus in medicine. Multiple small meals is the way to go. Personally, I had more success with intermittent fasting.
Yeah,
I've heard fasting is really good too.
It completely depends. It really, really does completely depend, because the multiple smaller meals has effects. It does, and what effects they are is not super conclusive. Like, people think that it increases the amount of calories you use per day, therefore it's better for your weight loss, because the calories out goes up without your calories in going up, because you're eating smaller meals to compensate, right? So it's a tough question for that one, and I can't answer. And that's an example of fucking nutrition being pseudo, because what is it? No one fucking knows.
Yeah, well, I have a great topic, but first I wanted to say this from the start, because you're talking about nutrition maybe being a bit of a pseudoscience, and you see that like every few years. Like, do you remember like what fucking 15 years ago when everyone goes, "Oh, you can't eat fat. Like, fat's so bad for you. It just makes you fat." But then like 2 years later, people are saying, "Oh no, you can have some types of fat that are good for you, but these are bad. And you need to stay away from them." And then a few years later, people go, "Oh no, it's not fat. Like, forget about that. It's fucking starch." And then there's that South Park episode where they're just taking the piss out of nutrition. It's like, "Oh guys, the food pyramid. We have to turn it upside down."
God damn it.
But I don't know. Like, I swear, there's always these fads or trends with nutrition, and it's because I guess people don't know what the fuck they're talking about. It's just inconclusive.
So, Minas, you being a heart surgeon can kind of weigh in on this, but like, this is one of the food fad things. Cholesterol is a huge one that I actually looked into quite deeply, because it came up in college as well. Because cholesterol can be consumed. It's also produced by the body. There's genetic factors that influence how much cholesterol goes in, how much cholesterol goes out. Like, and it's just really messy. And honestly speaking, like, there's no direct evidence to suggest that cholesterol intake. So there is, right? There is. That's the hard part.
If I would say there are conflicting evidence with the next point that you're gonna say.
Yeah, there's conflicting evidence to show that cholesterol intake actually increases the amount of cholesterol in your body. But then there's also evidence to suggest that it's a really big genetic factor. And then there's also evidence to suggest that it's
inflammation.
Inflammation,
all
yeah.
three, right?
And it's so much like what the
like my dad's a cardiologist, so we we tend to discuss these types of articles that come up and time again, and you just sit down and just like, what the fuck is this new thing, right? Because the we have, for example, a good argument for the whole genetic part is the Inuits, the Eskimos up in the Antarctica. They have not Antarctica, North Pole, sorry. They have like huge amounts of cholesterol. We're talking about 400 cholesterol, and
What's
they
normal?
have the lowest rates of.
What's normal cholesterol?
Normally now beneath 150, 100. It depends. It changes. I would say
Okay.
beneath 100 these days. But again, ask me in 2 years, it might be 80.
Okay.
It's really like 200 total cholesterol and 100 bad cholesterol, the LDL. They have like 400, 500, and they have the lowest incidences of heart attacks worldwide.
What the
And it
fuck?
doesn't make sense when you have people that have like 90% stenosis in their coronary arteries with a 120 cholesterol.
Yeah, it
It's
doesn't
just
make
like,
sense.
wow, what the fuck? Why? Like, if cholesterol is bad, what's happening? So that's the genetic part that we have proven. Then there's a gene that actually deals with it way better than the rest of us, right? And then there is the success of the Mediterranean diet, which proves the nutrition side of things. What Pinky said about reducing intake of cholesterol helps, which kind of makes sense. Yeah, and then we have people with chronic inflammation in their vascular inflammation, like Takayasu, not Takayasu. Anyway, silent heart disease and stuff like that, where you have inflammation of the vessels, and thus you're getting huge atherosclerotic plaques, stenosing everything. And you're like, what is the deal here? And I would say, conservatively, don't eat cholesterol, because that makes the most sense, because unless you have a gene, then tough luck, you can't do anything about that. And if it's a disease, you can deal with that anyway. So just the last thing that's left, just try to reduce your cholesterol. Now there's extra things that are coming on, omega-3 unsaturated fats, unsaturated fats, and then how do they play?
Polyesters, right?
And there's so many things, and then you have like antioxidants, and then you have it's you can't get, like, I don't think there is any doctor or nutrition scientist or culinary scientist that will tell you in good conscience this is how it works.
No, of course
Nobody
not.
knows for sure.
Have you
No
guys
one
seen the Game Changers?
That vegan thing?
The vegan thing on Netflix.
Fuck's sake, that pissed me off so much. There's like
I'm
3
glad
or
you
4
said
people
that.
in my course that are like, "Oh, it's so hard going vegan now because this Game Changers thing," and oh.
So you did watch it?
What?
So you did watch it?
I didn't watch all of it. No,
Okay, that's fine.
should have.
But you've seen some of it?
I've seen some of it, and most of it that I watched was kind of like, "What the fuck is even going on here?"
Have you seen the Joe Rogan podcast with the guy who debunks it?
No, I haven't.
And then I'm guessing you haven't seen the Joe Rogan podcast with the guy who debunks it and the guy who wrote it.
No, that sounds fun.
Fucking brilliant.
Okay,
And
I think I found what to see today.
Yeah, you need to watch it. But pretty much, I was in the same boat. I heard everyone talking about the Game Changers and about how they're gonna go fucking vegan. And then I watched it and I thought, holy shit, this is fucking insane. Like, these world-class athletes are just purely vegan, and they're doing like 10 times more. And this guy himself is saying that he used to be only be able to do like 10 minutes, and now he just did an hour straight, which is half an hour more than everyone else in the fucking gym. It's like, yeah, this looks pretty crazy. And then you watch the Joe Rogan podcast with the guy who debunks it, and yeah, he's done his degrees in nutrition. Like, and the reason I like him is because he's done like a master's degree in nutrition. But he claims he's not an expert at it because he understands that the field is so diverse and difficult, right?
Vague. It's a word
Exactly.
I'm usually using.
Yeah, it's such a vague field with very inconclusive evidence, and you just hear him debunk pretty much all of the shit. And then when the writer comes on the show and they're having a somewhat of a debate, I think there's only like one thing he said that he got wrong, but the rest of it, the writer couldn't actually disprove or say was right. But it was funny because the guy who the writer, when he came on and had the debate, didn't give any evidence of any like scientific sort to prove or to even like say that what the game changer said was right. But he just bullied the guy who debunked it. He was just a fucking jerk, right? He was interrupting him and talking over him and just being loud and obnoxious. But because he was being more vocal, a lot of people in the comment section actually thought he won, which I thought was really interesting because his point of view is pretty much completely unscientific. He just said a few things like, "Do you know how to read a forest plot?" It's like, "No, I don't know how to read a forest plot." It's like, and then he just mentions it the whole time. It's like, "Oh, well, you didn't even know how to read a forest plot." It's just fucking immature.
Yeah.
But I thought the whole documentary was funny because it just shows like kind of conspiracy theories in a way. Where if you say something in a convincing way with anecdotal evidence, then you don't even consider the alternative points of view or evidence. Like one really important thing actually in the game changes was that eating red meats causes inflammation, which is actually not true, from what I've heard. I think there's conflicting evidence, to be honest, but it's nothing.
I don't know about inflammation, Joy, but I'm positively sure that's the thing that it does cause higher incidence of colon cancer, the red meat.
Okay.
Don't know how that is
I don't know
how
how
that
it's,
is
connected either.
connected with inflammation. I'm not sure, but it's we have more than just one. Like we have huge epidemiological studies that have proven that with meta-analysis and systematic reviews to check actually like make sure that is actually the truth.
But I recommend the game changes to everyone, but if you're gonna watch it, then make sure you watch the Joe Rogan podcast afterwards, which debunks it. I can't remember his name. I want to say it's Steven or Chris something. And if you're interested enough, then feel free to watch the podcast Joe Rogan does afterwards with both of them. And maybe you have a different opinion on it, but I thought the way that he debunks the game changes is like really scientifically concise. He just takes these papers and it's really good. Like, you know, for example, one thing I can kind of remember off the top of my head is I want to say it was about red meats and inflammation or something, right? But he pretty much found a study which showed that 74% of people who, it could have been something else, but I'll just say it was red meats, right? But it was a systematic review which found that like 74% of people didn't have like the more inflammation, right? 12%, they had less inflammation. Then 12% had no changes in inflammation, and then 74 plus 12 would be like 86, and then 14% had more inflammation, right? Like I'm making those numbers up, but to give you the point. So he said eating red meat had no effect on inflammation. Like it didn't like really have an effect on increased inflammation with 86% of the sample, which is correct. But the guy who like made the game changes completely like skewed the figures. He cherry picked like these random fuck off articles out of nowhere. He didn't use like systematic reviews or anything, and it was really skewed. But I thought it was interesting because I knew this like when watching the game changes, but it was so convincing. Like it made me want to go fucking vegan, even though I knew during the moment that it was probably bullshit, which is strange.
Yeah.
I don't know, but the whole veganism thing, it's for me, it's like I can only understand up to pescatarians.
Same.
Or that's it. That's the.
I think it's a moral thing for a lot of people
because of environmental factors. Everything else is just bullshit for me. Like, it's not better for you.
It's
period.
Not.
It's not better.
No,
for you.
It's not. I can guarantee you that because, like even if you consider the things like you have less saturated fats and you have less of the things that are debated like red meat and so on, you still have, like, a skew in your mineral intake, which is bad.
Yeah, and then the excuse that vegans give you is that we can just take pills, right, and tablets for that. But
no, because absorption rates are way lower.
Exactly, and the guy who debunks it also talks about that because he looks at the absorption rates and like efficiency of those things individually, and like if you're having a pill, it's like I can't remember the conversion or like comparison he made, but it'll be like eating like I don't know 8,600 nuts or something.
What's actually crazy as well is there is a difference between, let's take iron for example, because iron is one of those things that don't get enough of in vegan diets, right? That's one of the big things. It's iron and B vitamins that are hugely missing in vegan diets. But if you take iron's example, you actually take in more raw iron in a vegan diet than you ever do eating meat. But there's a difference between
The quality of the iron.
plant-based iron and meat-based iron called heme and non-heme iron, right?
Yeah,
He talks about that
basically
exactly.
on their power. On their,
Exactly.
You
So-
guys should really watch the podcast. You would like it, Pink.
Who? What? Oh,
You-
the Joe Rogan thing.
yeah,
Yeah.
yeah, you
I will.
will.
But the heme iron absorbs to a factor of like 8 times more efficiently in the body than a non-heme iron. I think it's a factor of 8. I could be wrong on the numbers. It was about 8 months since I learned about specifically the iron differences, but it's a massive amount. So there was like a comparison that my nutrition lecturer was going over, where it was like, if you eat spinach, which has more iron content than red meat, you'd have to eat like 50 kilos of spinach to make up a kilo of red meat. No, more than that even. And it's just like ridiculous amount of comparison to get the right iron content.
The guy on the podcast said pretty much like he made a similar comparison, and the difference is fucking crazy. So like when vegans say like, well, I think they say in the Game Changers, that's actually one of the main fucking arguments in the Game Changers is they say you actually get more protein with a vegan diet than you do in a meat-based diet, right? In a normal diet, which is just fucking like, yeah, it's true, but you're really distorting the data because the quality of the iron you're getting is much worse. Like you're not getting as much as your body needs.
Also with the protein, right?
Yeah.
The body doesn't really care about the protein per se as an energy, but they care more about as a structure, as a building block. And you don't take proteins as such. You take amino acids from the proteins that you break down. And certain amino acids do not exist outside of meat, of raw protein.
Yep.
Right?
So that's partly true.
I mean, you do have the superfoods, Pink, but then again, or you can have like food supplements. But again, I'm asking you, when this becomes not normal. So why is it abnormal to eat meat, but it's normal to not eat meat and take pills?
Yeah, I think a big problem as well with the argument by the Game Changers, and actually, Pink, this would be a great idea if we just like either both rewatch it or like you watch the podcast and we talk about it, or we could do that with something else. But anyway, I think a big problem with the kind of argument with the Game Changers was it pictured veganism as this great diet which has no drawbacks. But worse than that is that it pictured a normal American diet as like this horrible thing. Whereas, whereas in reality, if you just have a good, healthy, normal diet, with some red meat here and there, and you actually like have things in moderation, then of course it's healthier. But they made it seem like you're eating fucking McDonald's every day, which is super biased.
And actually, on the note of red meat, right? I think me and Minas talked about this before, but it is actually, in my opinion, good to cut down red meat a little bit. But then it depends on what you mean by red meat, right? I'm talking about highly bred, steroid enhanced beef as my example. Like cut that down by a lot and you'd be better off, because there's going to be so much extra in there that you don't know what's going on, you don't know the source of it and so on. But naturally raised, farmed organic meats, like red meats, even you'd consider red meats like chicken thighs, lamb, even some beef that, not the over raised stuff, but like, decent amount of stuff. There's very little evidence to show that there's drawbacks there. Like even if you have a bit of it like multiple times a week.
I don't know, it's just
the biggest plight is the over farming, and that not only the biggest plight on environmental issues, but also the biggest plight on animal cruelty issues is the over farming of these like meats. Like crazy things going on there. That's why
horrible.
I'm personally in the camp of let's go clone meat. And no, it's not some weird scientific injection bullshit that some people think. It's actually really a good way to produce the meat.
How would you do it?
What you do is you get a tissue sample from an animal that would be healthy and that the genetic profile would give a good quality meat. Probably something like Kobe beef or something like this, something that is really good and high quality. You take a tissue sample, not a big one, so the animal isn't hurt. You take care of the animal, let it live out its life and whatever. Then you use that tissue sample in an incubator and let it replicate and grow. You don't change its genetics or anything, you just let it naturally grow. And then you keep subdividing that and let it grow more and more, and eventually you just grow the meat out of it, essentially.
Wait,
The
what, the meat just happens? Just turns into a little
well,
baby
yeah,
meat?
basic mitosis, like you get the meat growing out of it. The biggest issue and difficulty of lab-grown meats, clone meats, right now is that it's very hard to build natural structures of meat. So we can easily replicate mincemeat, right? You just grow a bit of muscle here, you grow a bit of fat here, you mince them together, no problem, right? So you can make meatballs, you can make hamburgers. That's no issue. You can do that commercially. In the next 5 years, it'll be commercial, no problem. But growing a steak with all the connective tissue, the fat lining, and all that, that's very difficult to do because we don't have we don't have the animal to as a scaffold to build around. So that's the challenge in lab grown meat right now.
Genetics is tricky because it's such a small like scale, and then you're kind of amplifying that to shit we eat, and it's really hard to like make a model around that. I can imagine. Obviously, I don't know the specifics around it, but fuck.
But again, you're not doing anything with the genetics. You're leaving the genetics the way the animal is. You're leaving it that way. You're even feeding the animal, like the cells, the same thing the animal would feed it in a sense. Like obviously the cells will be fed by the bloodstream and so on, and Minas probably has more of an input than I do there. But you're giving it a nutrient solution, essentially what it would be getting from the animal. So it's the same feed as you would give the animal. Then you just let it grow. So the genetics are the same. You're not changing genetics. The issue is scaffolding and shape. Like if you just sell mincemeat, it's not a problem. If you want to sell steaks, which is going to be the big market, like chicken fillets, steaks, large muscle cuts, premium cuts for really cheap. That's where the big market is for this. That's really hard to achieve.
I'm guessing it's expensive, or is it not?
It is expensive because it's specialty right now, but it won't be expensive if the scale goes up, because you can use previous product to make a new product. So let's say you make 500 kilos of it, you can sell 250 kilos, subdivide the remaining 250 kilos, and make 500 kilos again. So it's not an issue there. If you scale up production enough, it's efficient and cheap.
I would eat it for sure.
You reduce also like waste, food waste.
Yes. You reduce food waste, you reduce the carbon footprint, you reduce all sorts of waste. So an animal like a beef takes up a lot of water, a lot of space, and it creates a lot of pollutants. This method of growing uses 99% less water, which is huge because water waste in food production is massive right now.
That's true.
It produces no discernible greenhouse emissions except for keeping the lights running, the heat going, and so on, because you don't have like a super active metabolism in these growing things. You do have some, so there's going to be some amount of carbon emission, but it won't be as high as an animal. And you have much less space because you can grow all the premium cuts in a small enclosed incubator space. So the same space that you can raise 100,000 cattle, you can raise the equivalent of 100 million if using this technology.
Shit. I'm completely for it, just from an ethical standpoint. I don't know if any of you have ever seen just how they kill cows to get meat, but it's pretty fucked.
Well, they have to kill them.
Well, yeah, but it's not enough to make me go vegan. But obviously, like. Sorry, Minas, continue.
No, it's fine.
No, you can go. I don't mind.
The question is like which type of slaughter are you referring to?
Well,
There's
yeah,
the kosher one, which is fucked up, and there is the more humane one. There's a couple of them.
I don't know which one it is exactly, but I know obviously they kill them differently depending on like the use. But the one I watched was when they pretty much just have the big grinder that like spins in circles. They sedate the cows. They put them on pretty much the supermarket thing. Then they just fall in it and it grinds them up slowly. It's fucking horrible. It's like probably the worst thing I've ever seen, because you look in the cow's eye, and whether it's like an emotional bias or something, you just know that it knows it's gonna fucking die, and it's shit.
Yeah. The slaughter method that's most commonly used in Ireland, as far as I know, is they put a bolt gun to the brain and just like shoot it, or they cut. If they want to kill and exsanguinate immediately, they cut the head off, and basically mechanically separate the skull from the body.
Jesus
Well,
fucking
in
Christ.
Cyprus, the kosher method, the one that de-swankified, as you very nicely put it, is specifically in pigs, is to puncture two holes where the jugulars are and leave the animal in panic to run around until it bleeds itself to death.
Jesus fucking Christ.
I am not a vegetarian nor a
That would
vegan,
make- yeah.
but I would never touch that type of meat.
No, same. Me and Ali, right? So Ali's my girlfriend. For those not watching, when we order food and the restaurant is listed as kosher, we don't go there.
Oh, do they have to
Yep.
list as kosher?
Yep, they do, because it's a religious thing, right? Killing animals in a kosher way is a religious way of killing the animal, and only meat killed in this way can be sold as kosher, so it's actually a positive marketing thing for them. And a lot of people think that kosher is better, but I make it a point to avoid it because it's fucking cruel.
Yeah, like killing an animal like this because it desanguinates it faster. It's sick, and I'm gonna tell you, this is so okay. When I was testing my Pink might be actually bored of listening to this. When I was testing my self-replicating aorta replacements, whatever, we were using pigs to run our tests on, and one way, okay, we were done with our experiments, and we had one pig that we have put down. We did a miscalculation, so anyway, and it was out, right? And we actually wanted to fill it up with one colleague had the idea to maybe make it a wine, a dipped pig.
What
So
do you
we
mean? Make
used-
the pig a wine?
Yeah, when you try and marinate the meat in wine
Oh, okay.
before you. So we had one of those pumps that replaced the heart during the extra bypass surgery. So what we ended up is just replacing the blood with wine. Easily, you could have done that to be kosher without replacing anything or adding some water in it. I mean, it doesn't have to be cruel. Obviously, it was retarded. What we did was kind of unethical as well. But okay, the meat would otherwise have been lost where we used it for grill.
Okay.
But I mean, I guess the animal didn't die in vain. We didn't throw the carcass away. That's what I'm saying. We honored
Yeah.
it by eating it in a way. Again, you could desanguinate this way. You can desanguinate with the mechanical decapitation, but seeing like punching two holes and just letting it run until it dies, I stopped eating meat for a month, and not because, oh my god, they put animals. I was disgusted by that, and I don't think that's.
Yeah, I think it's cool.
It's anyway.
Dude,
If you like
I just-
kosher meat and you don't care about that, then maybe don't feel the need to subscribe. Or you can. I don't care. But I think personally, we all agreed that it's just extremely unethical. I didn't know they did that, to be honest, and that's kind of fucking disgusting. I mean,
It's so much unnecessary
It's
stuff.
a religion thing, so you can't really say too much about it without sounding like what you might sound. But I don't know. It's a kind of a cruel method, killing animals like this, and it's actually very weird to me to see companies like PETA and all the other bullshit that comes up that never bring up that issue, right?
That's because PETA's a marketing firm. They don't
Yeah,
care about animals.
Yeah, but there are other also, and they don't even talk about this. And I'm like, okay, guys. I mean, okay, you are annoyed because I'm eating my chicken. Okay, I get it, but what about? Okay, I'm doing the whataboutism, but isn't that a bit more higher on the list? Like torturing animals before they die, because it's torture in the end.
yeah, it is. I mean, if you're gonna die anyway, right? Someone said, "Look, I'm gonna kill you. Do you want me to stab 2 holes in your jugular arteries, or do you just want me to shoot you in the brain once, or like
Just
give you a
shoot in the
pill?"
head.
It's like, what?
Exactly,
You think I'm gonna fucking choose that? Like, obviously, it's not fucking ethical or great that we're killing them anyway, right? But obviously, we've got people to feed, and it's gonna
It depends
happen,
on
right?
how you want to approach if it's
Yeah,
ethical or
right.
not.
But
Like
it's
if you're gonna
like,
go for the of the Genesis type of thing, right? God created man, and God gave man all control over the food, over the animals on the earth. If you're gonna go to the theological route, if you're gonna go to the do not kill or live and let live, then yeah, you're wrong. But depend what model you wanna take
See,
as a
my
basis
my
of an
personal
ethical.
model is morality and ethics come down to a question of suffering or maximizing non-suffering and well-being, and essentially, that's how I approach it in, I believe, an objective manner. We can argue about that if you want, but basically, morality is relative to any action with the objective viewpoint of trying to minimize suffering and give the best well-being possible. If when we approach any specific question, right? Um, what maximizes well-being is how I would see whether or not something is moral or ethical. Well, maybe not ethical because that has all sorts of other
well,
things in
what
medicine,
if you
right?
have a moral, philosophical conundrum where you subjectively feel like you're doing the correct thing, or something which minimizes the amount of suffering, but in fact, or because of lack of hindsight, you're actually doing something which creates more suffering.
Yeah, so that there's subjective answers here and there is the objective answer. So the objective answer is if you're creating more suffering that way, then it's not moral. Whether or not you're aware of it is a different question, and whether or
Well, I
not your
think
decision is dependent on you're aware of it. Like your decision will be dependent on whether or not you're aware of it. If you think you're making a decision that reduces suffering, but actually it increased suffering, you made a decision that you thought was moral, but it turned out not to be.
well, I think morality is based on intentions and not
In the
necessarily
moment, for
outcome.
sure.
I think morality is based on intentions and not outcome. If you were trying to do the right thing, then I think that was the moral thing to do. And if you didn't know the facts, or what would happen, then it's still moral.
Yeah,
Even
yeah, but that's exactly what I'm saying. However, if you find yourself in the same situation again, you look back at what happened before, and now you know that not doing that thing is the moral choice, so therefore you won't,
okay, right.
right? It's about if you don't know what you're doing increases suffering, and you make the choice with the intent to reduce suffering, then you're making the moral choice, even if it's not objectively the correct moral one,
Okay, so
right?
I just got confused because you said objectively it's not moral, but I thought objectively it still was moral. It was just objectively not the correct moral thing to do.
Yeah, well, it wasn't, right? Because at the end you increase suffering, but you
Yeah,
made
but
the
I
correct
think
moral choice, like you said, because you weren't aware of it.
yeah, sure. I agree. What do you think, Minas?
They said this is the like okay, both of you said if you believe, right? So my beliefs, for example, when you said like if you believe you're doing the best thing, right?
Mm-hmm.
Mm.
From whom's perspective? For
In my
example, they
opinion,
have been
overall.
dictators in the past that thought they were doing the best for their belief system, their country, their. I'm not targeting anything particular, right?
Mm-hmm.
Minas, I'm German.
So
Watch yourself.
no,
Joking.
that's why I'm no, let's use Saddam Hussein or Kim Jong Un, right?
Oh yeah,
I'm
Kim
sure they
Jong.
think they're doing the best for their people. So is that then moral?
So again, it depends on if they're. No, it's not. But the reason why it's not moral, under my point of view, is because you can quantify specifically to them and show that what they're doing is actually increasing suffering and reducing well-being. And it's not like it's not like they're making a minor decision that has some impact in increasing suffering, and therefore they can get away with it because they really thought this was the best thing to do and they just made a mistake. There is so much evidence and so much like knowledge out there to show that they're actually causing suffering and reducing well-being, that they can't claim, oh sorry, I just didn't know about that, I'll change my ways, and say that was moral. They are obviously doing stuff that reduces well-being, and therefore it's immoral, even if they think it's moral.
Yeah. Okay. Oh, that's a beautiful cat, Siamese cat.
No,
It is.
ragdoll.
Turbo.
Hey, buddy. You want to be on the
So
podcast?
tame.
Like there could be situations where killing someone is the moral decision because you can save more people that way, right?
Well, then you
Let's
have
use
the classic philosophical scenario,
the trolley problem,
the
right?
trolley problem. I've actually gone over that.
Yeah.
like-
Yeah,
Psychology.
if you force the car to drift, you can kill people on both sides simultaneously.
Exactly. No, but the idea here is that my view of morality is subjective to a viewpoint. It's true, and the viewpoint is minimizing suffering and increasing well-being. And as long as we focus on that subjective viewpoint, we can make objective statements about it. That's
I think morality is generally overrated. I think
Well, yeah.
morality is also causing a lot of our technological abilities and leaps in science to be stopped because some actions are immoral. Obviously, I do not support what certain scientists have done in the past. Obviously not, but we are extremely, extremely constrained by those ethical.
yes.
Well, you mean like
discussion.
stopping research on quantum physics to make a fucking nuke?
No, I was talking about Mengele, but that would be like I was referring to medicine more clearly.
it's the same thing.
But yeah, exactly. Also that, or the whole stem cell research that has been halted because of
Oh, don't
I
even get me
understand.
started on
Yeah,
that.
I
Holy
know,
shit!
I know. See, so it's like if we're gonna take it for the greater good, right? Quoting the hot fuzz, but that should not be branded as immoral, because if you're able to grow a liver, you can save lots of people that die from,
And why is
lack
it
of
even
transport.
branded as immoral? Because you're not actually hurting people doing it. Like that kind of like specifically
taking
stem
Well,
cells,
then
right?
again, you
cells.
can say those cells are in power humans, and you turning them into livers are killing people.
Yeah, but that's like the whole abortion thing, right? Obviously, it's a touchy subject. Everyone in America has a different view on abortion.
It shouldn't be a touchy. Like we're not in America, though, right?
Yeah,
It's very
exactly. I mean,
simple.
we're on the internet where
Very
everyone.
Alright.
But
All right,
like,
why don't we
there's-
try?
Have every right to.
Exactly.
Can we even get into that discussion?
Fuck
Yeah,
it, we're getting into
absolutely.
it.
Sure. Okay.
I think it's the same as
Women-
stem cells. It's
Uh,
not. It's
like,
not a fucking
okay.
baby.
It's all right. So
Even if it was.
even if it is, like, okay, let's cut the crap. Let's not start the. Okay.
Depends when.
The discussion in the medicine is, oh, when it's after 3 months, you cannot kill it anymore. And
Yeah.
usually, most of the laws are like, oh, after 3 months or after the heartbeat. Bullshit. Okay, and I will tell you why. If you're gonna go and make a tattoo, right? Do you have to get a permission? Do you have to see a psychiatrist or a psychologist to consult about marking your body forever? No, it's your body. You can do whatever you want with it.
Technically,
But
It's a false equivalency. It's a
Well-
false equivalency model.
there is an exception.
Oh, okay, which one?
The exception is if you're if you want to change your sex, you have to see a psychologist for
That's a different
Some amount of time.
kind of worms, though. That's a different kind of worms. Right?
Is
Yeah,
it?
I
It's still
hear
doing
you,
something with
I
your
agree.
body.
I agree with you, but that's a different. That's a different type of thing. But when you put a parasite inside the other one, which is a parasite, the way it feeds is it leaches nutrients through a tube. There's a lot of parasites, a parasitic way of living until it gets born, which is typical across all.
I think it has a negative connotation, but you're 100% correct to say that.
I mean, yeah, obviously, it is what it is. Like, I can sugarcoat it, but it's not like it doesn't ask for your permission. If it can happen while you don't want it, so it's kind of a leech at that point, right? And you not having the chance to decide whether or not you want to have this baby, because here's the thing: a birth, it's not a willy-nilly thing. Many
hurts,
things can go
apparently.
wrong. Preeclampsia and eclampsia is one of the most common killers of women.
Postnatal
Not to
depression.
talk about bleeding and other complications, right? What?
You have postnatal depression as well.
Yeah, okay,
Postnatal
yes, of
psychosis.
But yeah, I mean, you have all the slew of the problems afterwards as well that can happen even without the pregnancy continuing, right? Sometimes there. So why am I asking a woman to put her life in the line when she doesn't want that kid?
Right.
And it's not like hey, just and the argument just bear until you birth it, and then we can take it away. So is that more moral? So are we using women as an engine, as a birth engine? It's even worse, like forcing a woman to keep something that she doesn't want to. So the whole discussion is based upon a religion that says all life is secret. If you ask anyone if they would go back and kill you know who, right, before they or before he got rejected from the art class, they would go, yes, of course I would kill that guy. Yeah.
Yeah.
Now suddenly not all life is
I
sacred.
just think the problem, like, yeah, obviously you've got the conundrum of, like if you're just getting rid of the baby afterwards, like giving it to another family, then is that more like morally, ethical? But then you've got also got people acting like aborting a baby at like 2 weeks is the same thing as giving birth to it at 9 months and then putting a gun to its head and shooting. So it's not the same thing.
So it's not the same
Allow
thing.
me to jump in here a little bit because I've been holding this thing. My view is that from even conception, right, from the very beginning, it is technically human and technically alive.
Yeah,
Okay.
I agree.
So whether or not it's a person or the potential to have a personhood, to me, yeah, absolutely, it's a person, and it has the potential to have personhood, a citizen, and rights, whatever. Okay,
Doesn't
100%.
change anything.
It doesn't, because my argument is entirely down to bodily autonomy, right? I think it's where you were going as well, Minas.
Yeah.
But
Not so
essentially,
eloquently, but yes, that's where I was trying to bring
Okay,
it.
I can give a
essentially,
counter argument here as
you
well.
you cannot in any way force anyone to do anything negative with their body, right? It's
Or
not the
anything
same
that
as
they might view as negative. Because
yeah,
some
anything
people
they
say,
might view
oh,
as
but
negative.
that's a happy thing, right? Yeah.
Sure. Anything that they might view as negative. So, for example, even if it's a positive outcome, as in creating a new life or saving a life, right? Let's put this, right? Minas is dying. Okay, he's gonna die in 5 minutes.
We all die. Yeah.
Right. So he's
Yeah,
gonna die in
so
5 minutes, and the only way to save Minas is, Joe, you have to hook your bloodstream up to Minas's bloodstream. You will not die from this. There could be complications. There might be pain or inconvenience, but you will not die from this. Can I force you to do it?
you can't force me, but I'll do it for you, Minas.
I
Of
love
course you
buddy.
will.
I would
Of
do the
course
same.
you will. And we can argue that this is a good thing, right? It's a good thing to bring a pregnancy to term and bring another human into the world and so on. This is a good thing. But you cannot force, and you should not be able to force it. If you want to get rid of it, it should not be viewed as killing. It should be viewed as exercising bodily autonomy.
Okay,
Exactly.
I 100% agree with you, and I have two really good points I want to bring up. One of them is from a book I read called Freakonomics a while ago, so the details kind of missed me a bit, but it's a good point nonetheless. But the first thing I want to say is, I actually 100. I thought I was going to disagree with you talking about like bodily functions and stuff, but I actually really agree with you. But I also see it from a perspective of consciousness. I don't argue that a baby or even a 2 week, whether it's a 2 week old baby, fetus, or whether it's like a 6 months old fetus, is no less human than if it was born. I think from the point that is conceived, it is just as much human as until the day it dies. But the key distinction for me is the amount, like the degree of consciousness which it has. Because I would argue that even if you're like if you've popped straight out of the fucking womb, then you're still like very barely conscious. Okay, people like may disagree with me, but at least while you're a fetus and you're still developing as an embryo, even if it's 6 months down the line, you're not a fully conscious human being, and so
They're
it's
not
different.
self-aware, I believe this is proven,
No.
right? Until later.
They're not, and so I'm not advocating that we fucking abort babies at 6 months old or anything like that, because honestly, it's probably impossible to distinguish when a fetus goes from non-conscious or unconscious to consciously aware, right? But sure, and maybe in the future we'll know, but it's a whole different ballpark. But I do agree with what you're saying. I think a second and kind of interesting point is about the moral implications of actually giving birth to that baby, especially if the mother doesn't want it. A really peculiar case happened in Romania, I think in the 80s, where essentially the rate of crime so abortion at the time, I'm gonna say it was in the 80s, but abortion at the time was illegal, and so you had a ridiculous amount of newborns and orphans going into the world, and then they'd grow up and they'd do crime, and like the rate of crime was just ridiculous, like unlike anything you've ever seen. But the funny thing is, when a few years later, abortion was legalized, the rates of crime dropped significantly, and this continued all the way out, like like years throughout afterwards. And they actually did a study with these orphans, and they found like these kind of biopsychosocial factors, which actually had like direct correlations to the crime, and to crime, and you're much better off to go and read Freakonomics, because one, it's a great book, and two, it's going to be much more detailed than anything I can say right now on this podcast. But I think just like if you're looking at the moral implications of like actually giving birth to that baby and what happens, because in this case it's like a real life epidemiological study, in the sense that these women were forced to have these kids when they didn't want it, and it really showed its effect on society. And you have to argue, like, is it more morally is it more ethical? Because we have these kids that are being born by mothers who don't want to do it, and then on top of that, they're growing up in really, really poor conditions, and then they're leading a life of crime most of the time. And like, if they're growing up and then they're killing someone, then does it just even out, or does it not? Because this person is is not representative of a good society compared to maybe the person that he or she killed, who is. And you've got all these different factors, but I would argue that it's not more ethical to give birth to the baby, especially when the mother doesn't want to keep it.
Yeah, I agree with that.
Yeah.
Can I also throw in a quote here? Now, I can't remember the quote exactly. It's been a while since I heard it, but I think it's true in context of our society currently, and that is, if you want to improve society, make it more wealthy, improve living conditions, increase education, so on, then the most cost-effective, easiest, and efficient method to do so is to give women all reproductive rights and personhood rights, civil rights, everything, empower them, give them education, and so on. Like, basically, what everyone was saying, equal rights for everyone on the same level, and then also all reproductive rights to the women. I forgot what the quote was. It was way more inspiring than what I'm saying. But you see that, like you said, in that country where the reproductive rights weren't given to the women and society suffered for it, right? And you see that in like even highly religious places in America, like what is it, like Mississippi or some shit, where the rate of teen pregnancy and attempted self-abortions and stuff is like higher than all of like really bad places combined. It's like crazy stuff.
Yeah, it's
Guys,
just.
I'm sorry, but I'm starting to sing double.
Are you tired?
Yeah, it's a fascinating discussion, but I'm starting seeing double.
No, it's okay.
I'm sorry, Mina.
I think we talked a lot though.
It's
been I think our best episode so far, and like to the point where I don't want to, but we could probably do a 10-hour discussion. So we're definitely gonna have to get you on again sometime.
If I didn't have was with 4 hours and woke up at 6 o'clock, I would stay. But at this point, like I kind of lost you back when we like kosher, and I kind of lost you guys. And then you asked me something, and thank God I was like I wasn't too far away from the subject. And then I sprang back.
I reckon you've
now I'm starting to like sing double. It's like shit.
No, I mean, yeah, I think we'll do the physics stuff for next episode, Pink, just in the end. Because, I mean, obviously we've got a special every 5th episode. We don't talk about gaming, but that doesn't mean we can't talk about whatever the fuck we want every other episode. So
I'm sorry, Pinky. I'm sorry, bro.
No. It's much longer than we were.
Dude,
planning
don't
to do anyway.
apologize. We literally planned for like 2 hours, and we're already 3.5 hours in. So this is
3.5. Like, who's editing this?
me.
I'm not envious.
Well, the editing is not too bad, but the render is going to take about 30 hours. So That's gonna be nice.
Hey, but no, I want to just say, Minas, thank you for coming on the podcast. You've been a great guest, and I always enjoyed these discussions with you on a personal level, but it's been good to have it with an audience as well.
Yeah, I definitely
Yeah,
want to give a big thank you to you as well. I mean, it's because obviously, I mean, we talked a bit before, but it was my first time maybe having a proper discussion with you, so it was really good. We definitely agree on a lot of things, so
Yeah.
definitely talk
Yeah,
more soon.
It was awesome for me to see different opinions and actually just discuss kind of hot button topics. Like the last abortion part, I was like, oh, okay, we're doing this. Okay,
Yeah, we can
okay,
talk.
Hey,
We can talk about
Okay,
whatever the fuck
can I
we want.
just the abortion thing? When I joined Minas's guild in Aries, the very first thing that happened was
Oh, yeah.
was this after the first raid or before the first? It was very early on.
It was
I was
before
talking.
the first raid even. Like it was just
Yeah. So
the
I was
first day when he got recruited, like the fourth or fifth day in the guild.
I was a trial, fourth or fifth day in the guild, was talking in an officer chat with Minas. Topic went to abortion for some reason, and we had this guy called Cypher, and it was just like big discussion about abortion. Is it wrong? Is it right? And it was just crazy for the first like day in the guild. It was insane.
It's actually quite fun. I've talked about it with a few people and like all these hot topics, so I don't mind talking about it. But with some topics, I felt like I definitely needed to brush up a bit more because it's been a few years since I've read some of these books or kind of seen some sources. So definitely for the future podcasts, I need to brush up a bit. But it was definitely a great podcast.
It
In
was
my
amazing
opinion.
for me. I really enjoyed the discussion.
Minus, we definitely need to get you back on sometime. Whenever you're free. I had a great
Conspiracy
time.
theory episode, man. You need to come back.
Please.
To conspiracy.
Oh please! It's gonna be let's go bonkers.
Yeah,
at that
10th
point.
episode, right? 10th episode special. We'll do that.
Yeah. Sounds
But all
great.
right, I guess we'll wrap it up here, though, guys. Thank you so much for sticking around for our 5th episode of the Diving In podcast. I hope you enjoyed with our special guest Minas, who's a heart surgeon, and yeah, just honestly talked about a bunch of shit tonight. So thank you guys very much. If you enjoyed the video, then please hit like and subscribe. It helps us out a lot. And stay tuned for our next videos. Here's your little kiss goodbye. All right, you're all sexy as fuck. See you next week.